we'll go ahead and get started and kick off with remarks from the President and CEO of the National Safety Council. Lorraine Martin began her 35 career in aerospace, where she made safety a top priority. And as a leader for NSC for the last 4 years, she is passionate about helping people live their fullest lives from the workplace to any place.
Good morning, everyone, and thank you for joining us today. My name is Lorraine Martin, and I'm the President and CEO of the National Safety Council. For those of you who may not be familiar with the Council, we are America's leading nonprofit safety advocate and have been for over 110 years. Our mission is to save lives, and we focus our efforts on workplace and roadway safety. We create a culture of safety at work so everyone can live their fullest life. In 2020, our mission took on a new urgency when the COVID-19 pandemic uprooted our nation, our workplaces, and our lives. The SAFER initiative, founded by NSC in April of that year, emerged from the uncertainty of that time and served as a crucial resource for many employers as they navigated the new landscape of work. That was almost 4 years ago. And while much has returned to normal since then, our world has changed in profound and permanent ways. Not only did the pandemic give rise to new challenges, it revealed others that had long been allowed to simmer in the background. So, as vaccines and other treatments enabled us to return to the rhythms of daily life, SAFER has shifted its focus away from COVID itself to the effects it continues to have on workers. Over the last year, the SAFER team has surveyed thousands of employees on mental health, remote and hybrid schedules, psychological safety, and the future of work. And they've provided recommendations for employers on how to address these issues and make their employees safer. Anyone who works in the safety field knows these topics are some of the most pressing of our day, and they're at the forefront of modern safety movement. The fact is that safety is not a static concept. What safety means changes and evolves over time, and it is deeply influenced by world events and the wider culture. The pandemic was one such world event, and it pushed forward the conversation on safety and showed us where we need to shift and broaden our definition of the word safety. To ignore the COVID years or try to forget would waste a crucial opportunity to move things forward, to learn from the pandemic, and use its lessons to make people safer. And that's what brings us here today. Over the course of this summit, you're going to hear from top EHS experts on these topics that I've mentioned and many more. We'll cover mental health, including loneliness, substance misuse, and burnout, and how employers can support worker well-being. We'll dive into psychological safety and belonging and hear some real-world examples of these concepts at play. We'll explore how to respond to the future of emerging diseases, and we'll closely look ahead at the evolving culture of remote and hybrid work. Through it all, remember that none of what you learn here is theoretical. Everything that we discuss, everything is about impacting real people and saving real lives. As you listen to these speakers and learn from their insights, I challenge you to think about practical steps to incorporate their words into your organization. Seize this opportunity to find new ways to make your workplaces and your employees safer. The pandemic years were hard, from the isolation of lockdowns to the loss of so many loved ones, family members, and friends. And now that we're through the worst of it, we cannot pretend it never happened. Difficult as it is, we must examine that experience and make meaning out of it and use it to help ensure everyone gets to live their fullest life and arrive home safe each and every day. From all of us at NSC, thank you again for joining us today and for your commitment to making people safe. Have a great SAFER Summit.
Thank you, Lorraine. And yes, we look forward to hearing about real-world examples on several relevant topics today. Before we get into the panels, we're going to hear a little bit more about why those topics were chosen, based off a recent survey conducted by the NSC SAFER team. Sharing those today will be Caitlin Lang. Caitlin is a senior research associate at the NSC, where she utilizes her master's degree to conduct quantitative and qualitative research, studying the impacts of the pandemic on the U.S. employers and the workforce.
Good morning, everyone, and thanks so much for joining us. I'm Caitlin Lang, the lead researcher on the SAFER Initiative. I'm delighted to be here today to share findings from our recent research efforts. The pandemic sparked drastic changes in how people live and work, with many of those changes now considered permanent in the workplace. So the National Safety Council's ongoing research under the SAFER Initiative focuses on key aspects of the post-pandemic world of work, including hybrid and remote operations, worker health and well-being, including mental health, substance misuse, and long COVID, as well as future crisis response plans. Nationwide surveys of workers and employers have been the main source of data for generating research insights, reports, and employer guidance materials as part of the SAFER research effort. Today, I'll share some high-level findings from 2 surveys involving 1,600 working adults and 300 employers. The surveys covered topics such as physical and psychological safety at work, workplace injuries, mental health outcomes and employer well-being interventions, COVID-19, and future pandemic preparedness. The latest SAFER research report with detailed results is available on the NSC SAFER website. I'll begin with some key takeaways from our findings on mental health and workplace safety. While we know that mental distress can heighten the risk of workplace safety incidents, our survey data highlights the potential bidirectional nature of the relationship between safety and mental health. The extent to which respondents felt safe at work strongly predicted their mental health outcomes. The survey assessed 3 distinct types of workplace safety: overall sense of physical safety, COVID-19 infection risk safety, and psychological safety. Those who felt unsafe at work in any way were 2 to 3 times more likely to experience frequent symptoms of depression or anxiety. As there has been a general rise in mental health issues throughout the pandemic, employers have noted an increase in safety incidents or absences which are related to poor mental health. Half of employers we surveyed last year reported that they noted a measurable increase in incidents related to mental health or substance misuse over the course of the pandemic. Now, although physical safety and heightened COVID-19 risks were correlated with adverse mental health outcomes, the data suggests that the mental health impact of the pandemic disproportionately affected individuals in jobs at higher risk for COVID-19 infection and pandemic-related job pressure. This group primarily includes essential frontline workers, especially those in healthcare, public-facing roles, and education. Respondents working in healthcare settings reported the highest frequency of anxiety symptoms, followed by those in public-facing roles and education. This aligns with broader findings that healthcare and frontline workers have consistently reported elevated levels of burnout, emotional exhaustion, anxiety, post-traumatic stress disorder, and depression throughout the pandemic. Now, workplace risks have always varied across industries and occupations, and the risk of COVID-19 exposure is no different. While certain jobs have always inherently posed higher risks due to industry-specific hazards, such as working from heights, the risk of COVID-19 exposure introduces new factors predicting risk levels for workers in different occupations and work environments. For example, healthcare workers typically face a higher risk of infectious disease transmission, but this risk was greatly exacerbated by the pandemic's unprecedented number of contagious individuals they came in contact with. Public-facing roles and education, once considered relatively safe, now pose more significant daily risks during the pandemic. Higher infection rates among these populations suggest that their exposure was linked to occupation, and although confirming workplace transmission is challenging, individuals infected with COVID-19 can often trace their exposure based on recent activities and things such as whether coworkers or family members tested positive around the same time. So, surveying those who tested positive, respondents in public-facing roles were most likely to believe they caught the virus at work, followed by healthcare workers. The majority of educators also believed they were extremely or somewhat likely to have gotten sick at work. In addition to assessing physical health and safety, survey respondents completed 4 mental health screening questionnaires focused on symptoms of depression, anxiety, alcohol misuse, and substance misuse. Aligning with recent findings from general population studies, our survey identified widespread negative outcomes among these participants. Within the past 2 weeks, half of respondents had reported clinically significant symptoms of depression, with a third of those reporting moderate to severe symptoms. A similar pattern was observed with anxiety symptoms. When asked about their current drug and alcohol use, a higher percentage of individuals using drugs and other substances reported experiencing problems at work compared to those using alcohol. Although alcohol consumption was more prevalent than other substance use, those who consume alcohol were less likely to exhibit warning signs of misuse. For example, among 70% of respondents who drink alcohol, 1 in 5 acknowledged that their use had caused work-related issues. In contrast, only 20% reported ongoing substance use, but half of that population reported that their substance use had caused problems at work in the same time frame. Now, as mentioned earlier, there is a correlation between poor mental health outcomes and workplace safety and injuries, as evident in our survey respondent sample. For instance, those reporting minimal or no symptoms of depression had the lowest past workplace injury rates, while rates increased for groups with worse depression symptoms. A similar pattern emerged between workplace injury and anxiety symptoms, ranging from 13% injury rates for respondents with minimal anxiety to 36% for those with moderate to severe anxiety. Importantly, this does not imply causation in either direction. Poor mental health can increase the risk of injury due to cognitive effects or possibly impairing medications, but injuries have also been found to increase the risk of mental health problems. Now, we observed a similar relationship between scores on alcohol and drug use screeners and an even more prominent association between severe misuse and a history of workplace injury. While only a small percentage of respondents overall showed signs of severe substance use disorder, 76% of those individuals reported a history of workplace injury at their current job. It's important to emphasize again that this doesn't imply causation in either direction. The use of impairing substances can increase the risk of incidents, and sustaining an injury may result in an individual being prescribed pain management medications, which can be highly addictive, potentially leading to continued or prolonged use. A concerning yet unsurprising discovery by NSC and other researchers throughout the pandemic is the persistently low utilization of employee assistance programs, or EAPs, despite the apparent increasing need for interventions. And although many employers are expanding EAP coverage or offerings, it is crucial to ensure that employees are aware of available services, especially during a time of heightened stress due to the pandemic, financial strain, and more, with some groups being even in greater need of support. For example, according to a nationwide survey by the American Psychological Association, the highest stress levels were reported by parents, younger generations, Latino adults, and individuals who felt they lacked adequate emotional support during the pandemic. And while we know the return on investment in worker well-being is high, there's also a need to assess the effectiveness of employer interventions to maximize the potential help and support available, aiding workers in living their best lives, both within and outside the workplace. Next are some considerations we've compiled for addressing mental health and well-being. Now, depending on your organization's progress in implementing policies to support worker health and well-being, there are valuable resources and opportunities for continuous improvement at every stage. For example, the Total Worker Health Workbook offered by NIOSH provides tools and a roadmap for assessing needs and implementing policies to support worker health and well-being. It's crucial, too, to recognize that there's no one-size-fits-all solution. So seeking input from workers helps target the most significant needs effectively. Additionally, keeping communication lines open ensures workers are aware of available wellness programs and how to access them, contributing to increased awareness, uptake, and ultimately impact. Now, for most of us, our coworkers are sometimes the people with whom we interact the most during the week. So teammates or supervisors may in some cases be well positioned to recognize warning signs if they are equipped to do so. Consider implementing training for both supervisors and workers to identify and respond to mental health concerns in the workplace. Now, this training may also cover emergencies such as the administration of the opioid overdose reversing drug naloxone, which is available over the counter and can be stored in first aid kits. Additionally, regularly reviewing workplace policies and making minor updates provides an opportunity to also conduct a language audit at the same time, ensuring that existing policies and procedures do not inadvertently discriminate or stigmatize individuals. And lastly, you can ensure that your communication captures the language and multiple media sources used by your workforce in non-stigmatizing and easy to understand ways in order to increase awareness and encourage uptake of resources. Last but not least, I'll address the safety concerns related to long COVID, an emerging issue among the population. Long COVID refers to persistent health problems lasting weeks, months, or even years after the initial COVID-19 infection, and is estimated to be affecting up to 1 in 5 Americans. Symptoms may include fatigue, shortness of breath, sleep problems, dizziness, joint pain, just to name a few. Data suggests that some workers with long COVID may struggle to return to work without modified duties. In fact, our survey found that respondents with hybrid schedules compared to those working solely in person were more likely to report long COVID symptoms. And while the survey lacked detailed explanations, longitudinal studies at Mayo Clinic proposed that workers with long COVID may require accommodations such as hybrid work schedules, potentially explaining their overrepresentation in hybrid work roles among SAFER respondents. Now, given what we already know about how long COVID may potentially impact workplace safety, there are several considerations employers should take into account when addressing the effects of long COVID on workers, including how symptoms of long COVID may put individuals at greater risk of workplace incidents caused by fatigue or neurological conditions, as well as how cardiovascular and respiratory problems can make physically demanding jobs even more taxing. There's also emerging evidence that people with long COVID symptoms may be at increased risk of developing musculoskeletal disorders, especially if their job role requires repetitive movements. Now, there are plenty of measures employers can take to support workers with long COVID. First, reasonable accommodations such as adjusted work schedules, reduced physical demands, modified tasks, or temporary job reassignments can allow individuals to continue working while minimizing the risk of injury. Implementing flexible work arrangements such as remote work options or reduced hours helps accommodate fluctuating symptoms and manage fatigue or cognitive challenges. Workplace adjustments, including ergonomic measures, assistive devices, proper lighting, and hazard reduction can improve safety. Employers can also provide training and education to increase awareness of long COVID among supervisors, managers, and coworkers, fostering a supportive and inclusive environment. Maintaining regular communication with workers affected by long COVID ensures understanding their needs, addressing concerns, and identifying potential accommodations or adjustments to enhance safety and well-being. To close, I'll note that sometimes this new normal is actually anything but normal. The conversation around COVID has shifted from solely mitigation strategies to the need for support in areas like mental health, substance use, hybrid work, and more. These are the key topics we believe are necessary to discuss moving forward, which will be covered in detail today by our upcoming speakers. For more information on survey results, you can download the full report at nsc.org/safer or by scanning the QR code on your screen. This concludes my brief overview of research findings. Thank you so much for listening. I hope you enjoy the rest of the summit as our speakers and panelists share their experience and insights for building resilience in this post-pandemic landscape. Back to you, Mark.
Thanks, Caitlin. Those are some really interesting findings that you shared, and we're excited to learn more about all of those topics from the employee survey in more detail. So we'll start with a panel of experts who will discuss workplace well-being around mental health, loneliness, substance misuse, reducing stigma, and more. We'll hear a short presentation from each panelist and then come together to have an open dialogue and answer audience questions. So first up is Dr. Dennis Stolle, who is the Senior Director of Applied Psychology for the American Psychological Association, where he oversees applied psychology initiatives across a variety of subject areas, including workplace psychology. Joining Dennis is Melissa Williams. Melissa currently serves as the Director of Marketing and Communications with the National League of Cities and has over 15 years of experience working with small and medium-sized nonprofits to help shape their narrative. Also on the panel is Abigail Barth, who holds a master's in public health and is the Research and Innovation Program Manager for the Foundation for Social Connections, Social Isolation, Loneliness, and Connection Initiatives. And last but not least, we have Rich Jones from U-Turn Health, He is an experienced therapist, clinician, and healthcare entrepreneur. His experience spans several behavioral health domains, including mental health, substance use disorders, and intellectual disabilities. As mentioned earlier, each panelist will provide a short presentation, and we will all come together at the end for Q&A. So please go ahead and kick us off, Melissa and Dennis.
Thank you, Mark, and good morning. First, I want to say thank you to the National Safety Council for extending the invitation and this opportunity for CEOs Advancing Health Equity to be part of this conversation. CEOs Advancing Health Equity is made up of 5 of the nation's largest nonprofit membership associations. NLC, where I work, along with the American Psychological Association, the American Public Health Association, ICMA, and the YMCA. The CEOs initially came together during the pandemic to raise awareness about and to improve health equity by providing resources to other nonprofits. Collectively, our organizations have a combined reach of more than 60 million Americans. About a year ago, as our CEOs were talking, they recognized the severity of the mental health crisis unfolding across the country and within organizations. But you might be asking, why do these 5 CEOs care about mental health? As you will hear throughout the presentations today, as leaders and organizations, we should all care about mental health. Striving for mental health in the workplace is an effort focused on supporting other CEOs who care about mental health. Our 5 CEOs believe that our collective effort and voice can help shift the conversation about mental health within organizations, building a safer, more resilient, and healthier workplace for all. I'll now turn it over to my colleague, Dennis Stoley, who will share some of the recent findings from the American Psychological Association about the state of mental health in the workplace.
Thank you, Melissa. What I'd like to do first is address the question of why focus on the workplace in particular. And it's because a psychologically healthy workplace is just critical for overall population mental health, because anyone who's employed spends so much time in the workplace. And it's not just the time you spend in the workplace, but things that happen in the workplace then spill over into your personal life, into your relationships with friends and with family. And when we look at this issue and think about mental health in the workplace, we like to take a very broad view of what the term mental health really means. And I like the definition that's provided by the World Health Organization, which points out that mental health is more than just the absence of mental disorder, but it's about a high level of functioning and the ability to cope with the stressors in life and the ability to do well in life and to achieve your goals. And that kind of a broad perspective was also recently adopted by the United States Surgeon General's office, when just a little bit over a year ago, the Surgeon General issued the first ever framework for workplace mental health and well-being. And that framework, in my judgment, is really a historic event, because I think many Americans think of the Surgeon General's office as being focused on physical disease, heart disease, liver disease, these kinds of things, diabetes, and so on. But this is a recognition that mental health and physical health are inextricably intertwined, including mental health in the workplace. And the Surgeon General's framework takes the many, many factors that can contribute to a psychologically healthy workplace and organizes them into 5 distinct categories. And those categories put forth by the Surgeon General are protection from harm, connection and community, work-life harmony, mattering at work, and opportunities for growth. So what we did at the American Psychological Association has conducted a survey to look specifically at those 5 areas or 5 buckets and try to collect data about how that's looking right now, get a snapshot of what that looks like in the American workforce. We surveyed more than 2,500 employed individuals across the country. One of the things that we wanted to learn first is, are workers even concerned about these issues? And the response was overwhelmingly yes. More than 90% say that it's important to work for an organization that values their emotional and psychological well-being. 95% say it's important to work for an organization that respects the boundaries between work and non-work time. And of course, hindsight is 2020. We may say, well, of course, people feel that way, but this is important data for employers to keep in mind, because in order to attract and retain talent, they have to pay attention to what workers want. We also dug into each of those 5 categories from the Surgeon General that I mentioned, and we found some good news. For example, we found under connection and community that a large majority of people believe that their workplace fosters positive relationships, and some even feel that their workplace is almost like a family. And that's very much good news, especially in a time when it has been said that we're experiencing an epidemic of loneliness. And it just highlights that much more how important it is to have a healthy workplace environment. But there was also some news that was maybe not as good. And so when you take belonging as an example, we measured the extent to which people say that they feel like they belong at work, and we divided it up by different categories of workers: upper management, individual contributors, middle management, and frontline workers. One thing that we found is a distinct difference, a statistically significant difference between upper management and frontline workers. Frontline workers are much more likely to indicate that they feel like they don't belong at work. This finding is important because it highlights that it may be hard for upper management, who does feel like they belong, to understand what it feels like to be a frontline worker. And so taking that perspective is really critical. Another thing that we looked at was the concept of work-life harmony. And this was really, to me, one of the most troubling results that we found. Less than half of the workers who were surveyed were willing to even somewhat agree that their employer offers a culture where time off is respected. Now, this is a survey. It tells us the frequency with which things happen, but not why they're happening. My opinion is that this is being driven largely by the fact that we all carry work around with us in our front pocket these days in the form of our smartphone. And so we need to begin to develop a culture where we create boundaries, even though we have the technology available to us to erase all of those boundaries. And that requires an intentional effort. We also took a look at the concept of mattering at work, and we compared how stressed people feel in the workplace. And we found that those who believe they have meaningful work, they indicate that they're stressed out at work much less frequently than those who say that they do have meaningful work. In the same way, we took a look at the concept of opportunity for growth, found the same thing. People who are satisfied with their opportunities for growth in the workplace are much less likely to indicate that they're stressed out at work. Those who don't are much more likely to indicate that they're stressed out at work. Again, this is a survey, so we can't say that there's a clear causal connection in one direction or another, but there's a relationship here that is worth paying attention to. That's clear from the data. We also took a look at the concept of protection from harm. This was another troubling result because we found that nearly 1/3 of service workers had experienced verbal abuse in the last 12 months at work. In my judgment, that is simply an unacceptable number of people experiencing that kind of work or that kind of abuse in the workplace. It may be coming from coworkers, it may be coming from customers and clients, but in any event, it is unacceptable. Further on this concept of protection from harm, and another troubling result is that we found that nearly 1 out of 5 workers describe their workplace as, quote, toxic. And so we gave them the options of choosing, is their workplace toxic or is it healthy, and some other options that were in between. And almost 1 out of 5 say that it is toxic. That's very troubling to me. You think about having a dinner party at your house and you have 10 people over for dinner and 2 of them are working in a toxic workplace. That is an unacceptable situation and one that needs to be addressed. And it's also another one where when you start to drill down on the data, you see differences between groups that are both interesting and concerning and that need to be addressed. So, for example, when you take a look at the work environment and you look at remote versus hybrid versus in-person, we are seeing a statistically significant difference where those who are in person are more frequently reporting a toxic work environment. Similarly, we looked at office work versus manual labor versus customer and client service. And again, we saw a statistically significant difference where those who are in client service, customer service, patient service are more frequently reporting that they are in a toxic work environment. So we really need to take a hard look at those kinds of circumstances where people are in person, they need to be in person, and they're interacting with others, and what is happening in those contexts that is causing people to report this kind of a toxic work environment. And one of the reasons that it's critically important to understand that is because that report of a toxic work environment is also related to a number of other concerning statistics. So, for example, we found that all those who were experiencing a toxic workplace were almost 3 times more likely to self-report that their own mental health was fair or poor as opposed to good or excellent. Again, almost 3 times as much likely to agree that their work environment has a negative impact on their mental health, and more than 3 times as likely to report that they've experienced harm to their mental health while in the workplace. And so clearly there is a relationship with reporting a toxic workplace and with these self-reported harms to mental health. And importantly, we ask these questions not just in the context of work, but people's overall mental health in life. And so what we're seeing here is that spillover effect, where it's not just that what happens at work stays at work, but it goes on to affect your relationships, your friends, with friends and family, and everything that's going on outside of the workplace as well. So that's a quick snapshot of some of the results that we found in our survey. And I'll turn it back to you, Melissa, to talk a little bit more about the Striving program and some of the things that can be done to address these issues that we found.
Thanks, Dennis. And as you heard from Dennis, like, our employees are really struggling all across America. We're just really stressed, unfortunately. But the good news is, as organizational leaders, we can really be instrumental in shifting the narrative and taking action to make our workplaces healthier. Our Striving for Mental Health Excellence in the Workplace offers 6 easy steps that employers can take supporting resources that we provide. You don't have to do all 6, but we've discovered from those who have committed to strengthening mental health in their workplace is that every organization can do at least 1. So each action that you see here has accompanying resources. So we invite you to visit our website to review some of the articles and other resources that highlight the value of supporting mental health in the workplace. from several articles to, next slide, case studies. We cover specific mental health topics, as well as more broad understanding of what it looks like for employees struggling with mental health in the workplace. We have more than 200 organizations that have already joined us, and I would invite each of you today to sign the pledge and commit to supporting your employee mental health and normalizing and influencing a shift in workplace culture. By signing the pledge, you show your employees your commitment to their mental health and making our workplaces healthier and safer for all.
Hi, good morning, everyone. My name is Abigail Barth, and I am here representing the Foundation for Social Connection to speak about our recent report that we released focusing on social connection through the work sector. Here at the Foundation, we are a nonprofit organization dedicated to creating a more socially connected future. And we do this by raising awareness, translating research to practice, and supporting the development of innovative solutions. So thank you so much to the National Safety Council for inviting us here today. And I could not have asked for a better presentation to precede mine to really get into and speak about the significance of addressing social isolation and loneliness and advancing social connectedness through work. So why are we here to talk about this issue? As many of you may be aware, we are, of course, facing a global crisis of disconnection. And unfortunately, this has been a longstanding public health crisis that many are just becoming aware of. Millions of Americans are socially isolated, lonely, or both. And this is indicated through data preceding the pandemic, of course, was exacerbated during the pandemic, and even in recent post-pandemic data suggests that we are still facing incredibly high levels of these experiences. And this might be the case, and we're still understanding why this is, but recent worsening indicators such as individuals living alone, decreased involvement in community groups, and things like social cohesion. We've included some statistics on the screen here. And I think, as Dennis so aptly stated, we bring ourselves to work, and also our experiences of work, of course, spill over and influence our lives outside of work. And it is so incredibly important to think about the workplace and more broadly the role that work plays in society in order to advance social connection. And also, I believe, as Dennis mentioned, in the Surgeon General's framework for workplace mental health and well-being, he discusses how there's tremendous opportunity for connection and advancing connection in the workplace. I won't spend too much time on this slide, but I did briefly want to just note that I'll be using a number of different terms throughout my presentation and sometimes use these sort of interchangeably and grouped together, but it is important to be aware and specifically name that loneliness, social isolation, social connection, disconnection, all refer to different experiences. They are co-occurring and deeply interrelated, but while loneliness represents a subjective, unpleasant, or distressing feeling because of lack of connection, social isolation refers to having objectively few social relationships, roles, and group memberships. And as we think about both the challenges and the issues that our colleagues and workers are facing, we also have to consider some of the sort of unique experiences and these different ongoing contexts. And in order to address this challenge that we are facing across society, we developed the social framework with our Scientific Advisory Council, which aims to support employers, service providers, government officials, folks all across all industries and sectors of society in order to accelerate progress, to advance social connection and test and evaluate solutions. And just very briefly, I'll touch on what you'll see on the screen here. At the center, we have our socially connected human who takes part in this wider system of industries, different places that they interact with day to day. And of course, today we're talking specifically about what happens at work and through work in society. We look at their experiences and opportunities to address social disconnection across all levels of influence using the socio-ecological model from the individual through the societal level. Then, of course, we overlay all of our layers of society, and through these intersecting lines, think about how they can support each other in building a more socially connected future. And through our report specifically focused on addressing work, employment, and labor. And the reason that we chose that sort of wordy title is that we both encourage anyone who reads the report to think about what happens in the workplace, but also think about more broadly who is working independently or working for themselves, and what is the role that work and labor plays in society at large. Not just thinking about what happens at work, but thinking about the communities in which workplaces operate and the influence that you as leaders and large corporations have in changing societal conversations and norms around social connection. And the goals of our report, as you can see stated here, are to equip many different stakeholders with approaches and policies they can test and use to address isolation, loneliness, and advance connection, identify gaps in the evidence base, and provide policy recommendations. And we go through each level of influence and explore opportunities to advance connection, going from the individual all through the societal level, focusing on the individual level, some of the promising approaches that we identified through our report, which was developed through expert input and a robust literature review, and continuing to be iterated. And if you go onto our website, you can see that we're still live, accepting input and ideas to continue to improve this resource so that it can be as most useful and usable for the many different stakeholders we've written the report for. Some of the promising approaches really center on removing barriers and increasing access to mental and behavioral health resources, and advancing workplace practices that will enable individuals to build skills and receive cognitive reframing support, which can stand in the way of someone who's experiencing loneliness and isolation from seeking support, from engaging in social interactions, and really create cultures that support those individuals. At the interpersonal level, thinking about those day-to-day relationships that exist across workplaces. This is just a snapshot of some of the promising strategies that we found, but these really focus on bringing forward approaches for things like the concept of family supportive supervisor behaviors, enabling peer support, creating team dynamics and programs that enable colleagues to support one another and managers to support one another. And one really interesting study that we came across was an intervention for 911 dispatchers, where every week these dispatchers had an opportunity to answer a prompt and share advice and best practices with other dispatchers. And this study found that even among times of high stress, they reported significant increases in feelings of support and belonging, which is just a really compelling example of how creating opportunities for individuals to support each other on teams can really stave off loneliness and isolation and build feelings of support. Then, of course, looking at the organizational culture level and thinking about networks, which is arguably the most powerful level of influence when we look at workplaces. We found a number of kind of interesting, you might be actually surprised to see worker autonomy listed on the screen here, but actually evidence has found that people who may be experiencing social isolation and loneliness, and anyone who's in the workplace, it can actually deter people from interacting and forming high quality relationships when those experiences are mandated. And in fact, giving people autonomy over things like their work location, their schedules, even participation in some ways in work events can be really important in order to make people feel empowered in the workplace and enable them to kind of create the kinds of relationships that they want to have, and also, of course, spend time outside of work and have that flexibility to build relationships there. So there's some really interesting research that we explored in the report focused on that. And another specific promising solution that we wanted to call out is about workplace design, which is something that I was not aware of before we worked on this report. And really, there's some really interesting research about how you create work spaces, and do those kinds of spaces really enable people to connect, or are they keeping people isolated behind doors? There's interesting research about having too much open space that actually doesn't enable people to sort of casually interact. And that's an important medium in order for people to form relationships, and additionally other interesting information about having opportunity and the ability to access outdoor spaces. And there's some really interesting data all about being in nature, having access to outdoor spaces in order to form connections. And some of the policies we have explored here are considering programs to promote employee flexibility and autonomy, and redesigning workspaces to really support connection. And then looking to the broader communities in which workplaces operate and society at large. First, we just offer a thought to really consider not only your colleagues, your managers, your workers, but also think about the experiences of your customers, the communities that you physically operate in, the communities whose ideas that you shape, and the platform that many corporations have in putting out information and raising awareness, across society. And on the sort of community level, there's some really fantastic research thinking about creating co-working spaces and how those can enable connection. So that's thinking about not only workers of a particular workplace, but also how workers of different workplaces can come together and work together, creating opportunities for employee volunteering to create connections between employees and a wider community in which you're working. And another idea here is also thinking about spaces that can be reused and opened up to the public outside of a particular workplace. And then expanding out to looking at this societal level. One of the most important things that we are trying to accomplish here at the foundation, and this of course requires so many voices to be a part of it, is raising awareness and destigmatizing the experiences of social isolation and loneliness. And of course, we've seen just incredible examples of so many leaders who throughout the pandemic and post-pandemic have become more open and are sharing their own experiences with, for example, their mental health challenges, and how this is really shifting how we as a society think about and destigmatize these experiences. And similarly, social isolation and loneliness are so often stigmatized, they're placed on the individual. And of course, we know that that is not the case. They're created by systems and community factors, and they're certainly not something to blame or shame anyone for experiencing. So there's so much opportunity to be a part of this conversation, to discuss experiences and really destigmatize these as a first step for people to feel that they can talk about their experiences and seek support. Sharing data on promising strategies that are working within your workplace is another really important technique, as this is such a developing and emerging field. And we're also advocating for other changes on a national level, developing benchmarks, and looking at ways that we can really evaluate and advance how workplaces can influence the social connection of society through all these different channels. So this is just a really high level kind of snapshot of all the different promising approaches and policies that we explored in the report. And we really invite you to review the report, share your thoughts and ideas, and also test things out. There's so much more research that we need in order to really identify those best practices and explore them for different settings, such as digital working spaces, for different worker types, and really importantly, for thinking about the experiences of leaders themselves, where often there's less research and solutions thinking about those who may themselves be experiencing social isolation and loneliness. And lastly, I just want to call your attention to a resource that we've developed here at the foundation. Whoops, I skipped ahead one slide. Here at the foundation, which is called the Action Guide for Building Socially Connected Communities, which is a 6-step framework designed to support partners, community members, leaders, including business leaders, to foster connection within their communities. And there's a whole host of different resources and interactive tools to really foster conversation, to currently understand the current condition of social connection within a community, whether that is within a workplace or within a broader community, and considering all the different factors that shape an individual's experience in that community, and work collectively to build towards advancing connection within the community. We include lots of different strategies, includes ones that are also certainly relevant for the workplace, and in thinking about the sort of broader community societal solutions. And you can learn more all about our findings from the report, our action guide, and more about what we're doing here at the foundation in order to advance social connection across society. And in closing, we hope that these resources will empower you all for us all to collectively work towards creating a more socially connected workplaces and a more socially connected future. So thank you so much for your time.
Good morning, everyone. My name is Rich Jones, and I'm the co-founder and chief clinical officer at U-Turn Health. And I'm going to talk a little bit about substance misuse. The interesting thing about my part of the topic, everything that you've heard everybody talk about to this point, Abigail, Melissa, Dennis, so on and so forth, all of those issues, substance misuse kind of runs through all of those topics. And I'm not trying to suggest that everybody who has a struggle in any particular area would resort to using substances, but I am going to suggest that a fair number of us would, and that it's a common way of dealing with some of these other issues that you've heard of. And to that end, I think what we need to do is expand the way we think about substance misuse and really try to wrap our mind around this idea of, we're not trying to identify addicts and alcoholics. We're not on a witch hunt to send people to rehab. Rather, it's a health and wellness issue. And I hope that you get this perspective as I go through my part of this presentation, that I'm not here looking for more people to sign up for my rehab, for example. I'm here to stimulate a conversation around substances, because I believe the biggest part of the problem when it comes to the opioid epidemic, the addiction epidemic, the overdose epidemic, whatever label you want to put on it, isn't that we don't have solutions, it's that people will not engage in the solutions. So real quick about my background, I'm a professional therapist, I'm an EAP, a certified EAP provider, but I'm also a person in long-term recovery myself. I'm in recovery from an opioid use disorder and an alcohol use disorder, and I've been in recovery for 23 years. And so I'm going to try to bring some of my personal experience to this conversation as well, because what I can tell you is, I knew I had a problem for about 2 or 3 years before I actually did anything about my problem. And the main thing that drove me away from help was stigma, shame, fear, and all these ideas around what I would call like traditional ways of helping people. I can't think of a better way of saying it. And I'm not disparaging those ways. I'm just going to challenge us to think beyond that a little bit. So these are some statistics, and I'm preaching to the choir a little bit. We know we have a problem. You'll see these numbers have stayed the same over the decades. This comes from the Substance Abuse Mental Health Services Administration in a survey that they do called the National Household Survey on Drug Use and Health. The reason why I like that particular instrument is it's been around forever. So we have a lot of longitudinal data. We can look and we can compare trends. And what's interesting is around the number of people who meet criteria for substance use disorder severe, which is the technical terminology for addiction. Interestingly, the word addiction is non-diagnostic. You cannot diagnose anybody with addiction. It's substance use disorder severe. About 1 in 10, 1 in 12 people will meet that criteria. And that number has stayed the same except post-pandemic. Now, the post-pandemic numbers have just come out, and I literally need to update some of my slides, but what you saw post-pandemic was an increase that's unprecedented and something that we really we're not even sure if it's an anomaly or not. It jumped from around 26 million folks who met criteria to about 46 million people. So it's one of those, it's a number that most people can't even wrap their mind around, that it's risen that much. And some of the other numbers that you see on this slide that I find interesting, if you look at that 5X number, that has to do with family members of people with substance use disorder. This is going beyond the person themselves. This is a person who's like a mom who has a child dealing with this, a husband who has a wife dealing with it. If you're a family member dealing with substance use disorder, you are 5 times more likely to wind up in the inpatient hospital for medical related conditions due to the stress related to dealing with that. And again, more statistics on here. 26% of people in the workforce report that they go home to active addiction. This is a problem that's eating our lunch, for lack of a better term. And I think what's going on is we're finally paying attention to this as a country. We're really turning our attention to the opioid epidemic drove it, but beyond the opioid epidemic, how do we want to talk about substances? How do we want to address our relationship with substances? And the one takeaway you're going to hear from me is, again, it's not a matter of how do we help and how do we do that. It's how do we actually get to people and start the conversation. All right. And again, the pandemic has put all of this on blast. There are all kinds of different numbers that we can throw out there related to the pandemic. The most interesting one for me was a 700% increase in online alcohol sales. That shows you that things cranked up, right? And what's interesting when you dig into some of those numbers around the massive increase in use, it wasn't necessarily that everyone out there started picking up alcohol, whereas they wouldn't have in the past, pre-pandemic. So I was not a drinker pre-pandemic. Pandemic came and it turned me into a drinker. A little bit of that happened, but what was more common was the folks that kind of had a propensity to drink really cranked it up. So it took folks who might have been at a 6 or 7 on the scale of 1 to 10 and cranked them up to an 8 or a 9. And then those of us those folks that have issues with alcohol, we really struggled during the pandemic. That group, the alcoholic group, for lack of a better term, really turned it up. And again, there's obvious consequences associated with that. If you are already drinking at a difficult level, at a dangerous level, and the pandemic comes and you crank that thing up, now you're opening yourself up to even more fallout related to the substance use. And again, just some more stats around it. The one area that I want to talk a little bit more about is this statistic, though. I could talk all day about the number of people that meet criteria for substance use disorder, and we could all come to agreement on this, but this is the more troubling piece of information. In 2021, 94% of the individuals who met criteria for substance use disorder did not receive help. Or another way of saying that is only 6% of people with an addiction issue ever get help. And that is actually where the rubber meets the road. We know how to help these folks, but we haven't developed a system that allows us to get to these folks. And that's where these kind of conferences and talking about like this Safer Summit is so important, because it's going to take the workplace and it's going to take a collaborative effort to actually penetrate this group. When you talk to folks who don't get help, so if you picture that 40 million people who meet criteria, what the researchers did was, after they found out the number of people who got help, they went to the people who didn't get help and they asked why. And there's been an assumption out there as the reason that most people don't get help is an access issue. Rich didn't get help because he couldn't find a rehab to take him. Rich couldn't get help because there wasn't insurance available to pay for him to get help. That is only the case in about 1.5% of the cases. Is it an access issue? The rest of the cases, it is a motivation and a denial issue. It is an approach issue, guys. And there's nothing more important than what I say right now. The reason we're not getting ahead of the opioid epidemic and the addiction epidemic, and we're not changing these outcomes in workplaces, is not that we don't know what to do. It's that we can't get folks to come forward because of our approach. Our approach is very punishing. And what do I mean by our approach? Our traditional recovery treatment approach. And I'm not disparaging any programs. I work in those programs, guys. I'm a private practitioner. I work in rehab. I am an EAP provider. I'm not putting anybody down. I'm just having an intellectually honest conversation. We don't know how to get to people who have this problem. And that's actually what we need to do better at. If you look and you compare substance use disorder with other chronic conditions, let's just take something like diabetes, for example. We would all agree that these are both chronic lifestyle diseases. Diabetes engagement rate is around 94%. Addictions engagement rate is 6%. Do I need to say more? So now let's look a little bit closer at what that problem is. Why are we not getting to folks? The number one issue and the number one reason is stigma. They don't want to come forward. We've set up a system that feels bad. I'll speak as a person with experience in this area. I knew something was wrong with me. I wasn't a therapist when I was dealing with my substance misuse. I worked in HR actually, but I was highly functioning. I was being promoted at work, but slowly but surely destroying my life behind the scenes. Going through withdrawal, not saying a word to anybody because of what? The labels, addict, alcoholic, the idea that I was going to have to go off to rehab. All of that kept me in a bubble longer. And it made me wait for what? It made me wait till I quote unquote hit bottom. How many people out there have heard the term hit bottom? This again is part of the problem. Do we really want to set up a system where we wait for things to get worse before we help people? But that's how it was in my life. Nobody said anything until what? An intervention was done. I hit bottom and I went off to rehab and got better. And I'm grateful for that. But what I'm suggesting is we can do things different and get to people earlier. A second part of the equation, we need to change and move off of a one-size-fits-all approach. Not everybody in recovery has to do total abstinence. I do. I have chosen to go that route. But there's a thing called medication-assisted treatment, for example, where you can have medication that helps you deal with cravings. There is moderation management is a legit, effective intervention. There's a whole model out there called motivational interviewing, which is about meeting a person where they're at and walking this journey with them. We have to get away from this idea that it's one size fits all. And if Rich is going to get better, he's going to go off to rehab and go to 12-step meetings for the rest of his life. Nobody wants to do that. Even though I am doing it, guys, and I did it that way, I think I would have been open to other options along the way. And we also have to try to get to people in a strategic way. We have to open the conversation, open the scope of our focus, and allow the substance use part of the conversation to piggyback on other things. I'll give you an example of this real quick. We had a situation where we were trying to get folks to show up to a drug and alcohol seminar, for lack of a better term, an awareness event around substance misuse. Nobody would come. Nobody would show up. I would be there week after week, and nobody would ever come until we changed the title to stress management. When we changed the title to stress management, everybody came because it's okay to be stressed out. It's kind of like a badge of honor. And we wove the substance use conversation into that title, if that makes sense. And that's how we got people there. We got to figure out a way to market recovery to people because they're just not showing up. All right, now there are many different ways to get this done. That if you change your mentality, if there's any one thing I could do, I would take a magic wand and I would just wave it and get rid of the hit bottom mentality. Because I know there are smart people out there that if they move off of that mentality, they will figure out new solutions. U-Turn Health, we were one of those companies where we moved off of that mentality. And this is just an example of a different way to try to get to people. We set up a whole entire system that is designed to penetrate upstream. We avoid terminology like addict and alcoholic. We avoid the languaging and the messaging that sounds harsh. We don't say things like, I'll give you another example. This was a common thing, and people would say it in the rehabs that I ran. They would come into rooms with people who were in recovery and say things like, okay, there are 10 of you in the room. 5 of you are going to wind up relapsing. 3 of you are going to wind up in jail. 1 of you is going to wind up dead, and 1 of you is going to make it. That is not the way we want to approach this, guys. We want to flip that script on its head, and we want to be a strength-based model. That will get more people showing up. And as more people show up, more people will get better. And as more people get better, they will help other people get better. And it'll become a snowball effect in a positive direction. But we have to switch our mentality up, or we're never going to get there. Now, I want to demonstrate, or I want to tell you about a study that we were involved in where this mentality, this is an example of a difference that it can make. Now, this is a little bit of a different application than what would occur in a workplace, but bear with me. These were folks, this was at Clemson. We did this with Clemson University and the University of South Carolina School of Medicine. And we did it at Prisma Health Upstate in Greenville, South Carolina. These were folks that were in an inpatient hospital due to their substance-related issues. So these were very serious substance use issues, like end-stage liver failure due to drinking, a lot of infectious disease due to shooting drugs, very serious conditions. You had 100 people in each cohort. Cohort A was treatment as usual. A social worker comes in, meets the person, and makes a referral to a local clinic. Cohort B, the same exact thing. Social worker does treatment as usual, but the only difference is you added a coach who was dedicated to keeping the person engaged. Going back to my earlier point, that the problem isn't what we do with people. The problem is, how do we keep people coming back, and how do we get them involved in the first place? So we wanted to see, did people engage in services at a higher rate if they had somebody dedicated to that, somebody focused only on, you can do it, a cheerleader, a coach, if you will. And these were the results. Excuse. If I can get it to advance, one moment. These were the results. The black line indicates treatment as usual. And you can see at 30 days, about 50% make it to their first appointment. And again, we're talking about the black line, the bottom line. And that's kind of intuitive, right? About half the group made it to their first appointment, but then look what happens. It falls off the cliff, and 6 months later, only 10% are still engaged in their treatment plan. The blue line indicates if you had somebody attached to the person, focused only on engagement, retention, encouragement, coaching services. And you can see what happened. It climbs immediately, and more importantly, it stays steady over the 6-month period. And at the end of the 6 months, 89% were showing up. This is the mentality that we want to try to put out there. This is how you start to get more people into the fold. You get real intentional about how you talk about it. You get real intentional about creating the right culture in your organizations. This study has now been picked up for a 4-site clinical trial with the National Institute of Drug Abuse. So we're very happy about that. And again, the main takeaway from this isn't necessarily what are we going to do with overdose survivors in this study. It's how can these principles of assertive engagement be applied in the workplace? What kind of mentality can you bring to your shop where you can say, I'm going to find a way to get to those people rather than waiting for those people to come to me? Because if you wait for them to come to you, unfortunately, too often, guys, it's the worst outcome. It just ends bad, right? In the day and age of a poison drug supply, it ends bad. This is how you can get a hold of me for more information. I'd love to talk more. Rich Jones at uturnhealth.com. And that's all I have. Thank you very much.
Well, great. Thank you, everyone, for sharing all the great work that your organizations do. So next, we're going to open it up for some questions from our audience. But first, we wanted to answer the most frequently asked question, which is to let you all know that we will have recording and slides available after the summit, and will be sent to all who registered for this event. So starting off, a question from the audience for Dennis. We had a question about toxic work environments. And so can you explain further about bullying and verbal abuse, specifically when it comes from management? And what steps can organizations take to foster a healthier and more supportive workplace culture?
Sure. I think that a focus on management, middle management is extremely important. And there's been recent data that's come out that really highlights the degree to which the behavior of managers in an organization can affect a person's life, not just in the workplace, but again, that spillover effect. So can affect their mental health and well-being throughout all aspects of their life. And so really, one of the things that I think is so important is simply training for managers. There is perhaps, some small minority of managers who just would maybe ignore some training and still behave in ways that are not productive. But my belief, at least, is much more optimistic than that. And my belief is that when there's behavior from managers that might be labeled as toxic, it's often just their effort to get the work done without recognizing the negative consequence that they're having on other aspects of a person's life. And so I would love to see us get to a point where in any organization, any large organization, part of the standard HR training that you go through every year, just like you go through training about the benefits and so forth, would be mental health awareness training for managers. Because I think too many of them simply lack the tools and lack the awareness of the impact that they can have. And if we provide them with the tools, if we provide them with the awareness, and importantly, make it part of their evaluations on how they're doing, we could really turn a corner on that issue, and that could have a meaningful impact.
Thank you, Dr. Stoley. That's a great answer about how to think about toxic work environments. So Beth from Minnesota asked how organizations can measure the impact of their workplace culture on employee mental health, and really digging into, are there specific metrics that can help identify and address what we were just talking about, toxicity in the workplace. So Melissa or Dennis, love your thoughts on this topic.
Sure, I can jump in to say that I think that one of the measures that the literature has shown is particularly useful, and in my opinion is also particularly useful and is very simple to administer, is a measure of the concept of psychological safety. And that measure oftentimes needs to be administered with small groups because it's difficult to talk about the concept of psychological safety across an entire large organization. But you can talk about psychological safety within a small work team. And when I'm talking about psychological safety, that's not analogous to physical safety, where it's protection from mental health harm. Psychological safety is a very narrow concept in the literature. There's a term of art that refers to people's willingness to speak up at work and share their opinions and contribute and be a part of the team, essentially. There is a 7-item questionnaire that accurately measures levels of psychological safety within a small team. It is available for free. It was developed by Dr. Amy Edmondson at the Harvard Business School. And if you just Google her name and Google psychological safety scale, you will find that 7-item scale. And it can be as simple as doing a little poll in an email to the members of your team and see how people are feeling.
That's great. That's a really simple and practical solution. So thank you for sharing that with the audience, Dr. Stoley. So Abigail, a question for you, and it's a good one thinking about post-pandemic. So do you see technology as a facilitator or a hindrance when it comes to addressing loneliness in the workplace? And are there tech-driven solutions that can be used to enhance interpersonal connections among employees?
Yeah, that's a really great question. And I think the answer is both, both, and it depends. And that's usually generally kind of our perspective. And I think with a lot of the research shows thus far is it really depends how it's used and in what context. So, and of course, we are still learning about the most effective solutions. There is really great evidence from some sort of early companies that primarily work in a virtual environment. I mean, I myself work virtually, and there are some fantastic solutions where folks are brought together and gathered for conversations and community building virtually. And that's one way that technology, of course, works really well in those contexts. And of course, in other contexts, it depends, right? For environments where people are in person, technology can sometimes stand in the way of connection. And I think that that's specifically an area where we certainly need a lot more research gathering and input. And I think that's the role that so many of our organizations and companies can play today to really understand better in what context and for whom is technology serving as an asset, and in what context do we need to think about how we limit it or how we use it so that it doesn't serve as a hindrance.
Yeah, I think the evolution of in-person and hybrid is, both a blessing and a curse sometimes. That's a really good point to highlight. And actually brings up a question that we received for Rich. So is there a correlation to substance abuse increasing if workers are working from home versus being on site, and some of these changes from the pandemic?
Yeah, it's interesting when you look at like some of the fallout around substance use in the pandemic. It's some of the most common sense kind of things that you would think of. There was an increase around alcohol consumption, right? And there was absolutely people would start drinking earlier than they normally would. And it's funny when you talk to people in some of these anonymous surveys, they also come up for it. They're very open about the fact that they would day drink. And it depends on what their job was and what they had going on in any given day. But it opened the door to some habits that could have been very, very problematic. Here's the interesting thing is that didn't really devolve into a brand new set of alcoholics, quote unquote. That's not how that went down. It seems that the real fallout and the real problem around the pandemic, it's not so much that we've created a brand new set of problem drinkers. It's that the problem drinkers that we had have crossed the line into something more unmanageable. Mm-hmm. So it's a little bit misleading. People think that all of a sudden we have this culture after the pandemic where everybody's just really drinking more than they ever have. That is not the case. But the people who were drinkers really took advantage of it. It really did increase. Some of the other issues around the other substances related to the pandemic, and this might be counterintuitive because you might not think about things like opioid use disorder and in certain environments where loneliness became a problem, right? But loneliness absolutely drives up the use of something like opioids. I'm going to speak from experience. Opioids do not relieve just physical pain. There's nothing that I've ever taken that relieves psychological pain the way that opioids did. So all of that is put on at a higher risk. And then the thing that we have to keep in mind is that on top of that, we have a fundamentally contaminated and poisoned drug supply. And we have all the dynamics that go along with that. And it's more dangerous than ever for anybody to experiment with anything or try anything. So all of that has created like a perfect storm for massive fallout following the pandemic.
Well, thank you for sharing both your personal and professional reflections. That's really important. So a quick question for kind of a round robin response. We've gotten from a lot of people a flavor of, how have employer approaches to supporting workers' mental health evolved before, during, and after the pandemic. So maybe Melissa, if you could lead us off.
Yeah, I think, Mark, one of the things we've seen from the Strengthening Mental Health in the Workplace initiative is that there's greater awareness, and that's a good thing, right? The conversations we've heard here today, our organizations are all doing additional work to make sure we understand this issue and how we can support our employees better. And I think that awareness and that intentionality on how to address this issue is something that is a plus coming out of the trauma of the pandemic.
Great. Are there other thoughts on the question of how the pandemic impacted the approach?
Well,
I'll throw. Go ahead. I'm sorry, Dennis. Go ahead.
Okay. I completely agree with Melissa about the increased awareness. And when I kind of look at the arc over time, what I see is, the mental health issues were not new and were not caused by the pandemic. They were already there. But then the pandemic comes along and it shines a light on the issue, and it also exacerbates some of the issues. And so then what we see is a triage type reaction from organizations. And you see CEOs stepping up and saying, we need to do something about this, and I'm going to carve out some of my time to address this issue right now because it's an emergency. Now that curve is sort of changing, and we're at the point now where we need to be finding our forever solutions, not the triage solutions. And so the CEOs are back in a space where they're saying, okay, I need to return to my normal duties, and I need somebody else to take over this function. And so we're at a critical point now where either we need to get middle management trained up and bought into these concepts and building on what has been started so that we have a forever solution. And if we don't do that, I fear it may fall back into the background.
Yeah, I don't know if it's appropriate for me to say it this way, but amen to that. And that's and I was going to say something similar to that. I think the moment in time that we have right now to try to take advantage of this and affect change that could be permanent and that could help people, forever moving forward. That's really the critical juncture we're at. There are things that are discussed publicly and events that I've been asked to speak at that I never thought I would ever speak at. That I never thought these industries would talk about this stuff. And so on one hand, it's so unbelievably refreshing. My fear is exactly what Dennis just said, that this gets to a point where do people get kind of burned out on talking about it? We feel like we've done enough about it, and then it just sort of fades back into the background, right? Rather than let's put action with the words now. And like, what is the next step in this process? Because at the end of the day, people have to start getting better. We have to start doing things that help people. It's too much. We're in an unsustainable trajectory if we don't. That's my thought.
And that's a good segue to another question from our audience that I'll kick over to Melissa and Abigail. But is there a generational or cultural influence on mental health awareness? For example, the cultural influence of being stigmatized, as we've been talking about throughout this panel. So can one of you comment on kind of these generational forces?
Yeah, I can quickly comment. And as the kind of discussion was going on for that last question, I immediately started thinking about some of the research specifically about loneliness and young people. And as we think about, sustainability in the future, unfortunately, what trends are showing is that young people are reporting the highest levels of loneliness. There are extreme levels of mental health challenges among young people today. So this tells us, the current state isn't supporting young people. And of course, it's not only young people. Unfortunately, these issues affect everyone of all ages and backgrounds. But that we have a future challenge to work towards, because people already, when they're young, are experiencing these challenges. So we need to think about how to support them today, and also be preventive, and think about how we make changes to support future generations that will, of course, just be a part of the world, and also be, contributors of workplaces, leaders in workplaces. That's sort of one of the areas that I pointed to that our research really didn't turn up a ton of promising solutions for leaders, right? There are gaps even in understanding different people's experiences of loneliness and solutions. So just one thing I think is really, really important to highlight, but I can kick it over to Melissa for something else you'd like to add.
No, I would definitely agree with Abigail on sometimes what seems the greater impact for young people around mental health, and probably giving some more attention to that. That's part of the reason the YMCA is part of our coalition, right? They're really interested in what this looks like for the young people who they serve through their community centers across the country. Additionally, I think there is an element that our group has seen that we're also exploring around civility and how that impacts mental health. So culturally, we've become a little bit of an intolerant society, right? And that is leaking over from just the workplace into other places in society. And so for us, the five organizations that are part of this group, we're really starting a conversation about how does that impact mental health as well.
Well, and that's something that we're going to be diving into at our event coming up on Thursday with the election next year. Polarization in the workplace, I think, is going to be a real topic for workplace mental health, and how do we build that culture of belonging in our workplaces. Quick follow-up, Dr. Stoley, there was a question from the audience to repeat the author on the 7 psychological safety items.
Sure. Her name is Dr. Amy Edmondson, Edmonson, and she is at the Harvard Business School.
And the book that you mentioned?
So she has a brand new book out about dealing with failure, and I don't know the title to that one off the top of my head, but the one she had out just prior to that, which is an excellent book, is The Fearless Organization, and that book contains a copy of the 7-item questionnaire that I mentioned, which again is free for anyone to use.
Wonderful. Well, thank you all so much. This is a really rich discussion, and we got into some really interesting topic areas. So thank you all for the discussion, and thank you all in the audience for your questions and your engagement. Please keep it up throughout the rest of the day. And as I mentioned briefly, for anyone who'd like to dive deeper on loneliness in the workplace and polarization and some of the trends that we're looking at for 2024, I'd like to invite you to join the Health Action Alliance's virtual event this Thursday at 2 p.m. Eastern. So you can register by clicking on the HA button below or on our website at healthaction.org. So next, we're going to look into psychological safety and how it can impact the workplace and its employees, why it matters, and examples of psychological safety among real organizations. So presenting on this topic is Dr. Shana Tiayan. She is the CEO and founder of Yes Wellbeing Works and partners with organizations to create better workplaces through the power of employee well-being, offering services in research and science-based trainings. Shana was also recently named one of the 25 emerging culture creators in 2024 for Culture Amp. Take it away, Shana.
Awesome. Good morning, everyone, or perhaps good afternoon or good evening, depending on where you are joining us in the world. Really excited to be here with you today to talk about the topic of psychological safety. You had a nice little teaser, it seems like, as I was listening into the previous section on the topic. And so in this session, we will dive deeper into what is psychological safety and why should you care. So the first thing that I want to sort of propose or ask you, how many of you who are joining us here today are interested in things like creativity or innovation? Or perhaps how many of you are interested in improving the group dynamics of your teams to be able to maximize productivity and ultimately impact your bottom line? I would imagine if we were in a physical space, most of your hands would be up. Most of you would raise your hands to say that was something you're interested in as a productive and growing business or organization. And so that is the topic of today. Would you believe me if I told you that psychological safety is a pathway to being able to achieve those things within your respective organization, department, or teams? And so let's start by defining what psychological safety is. I'm really big on common understanding of terms. So I want to make sure that we all have the same understanding of what is it that we mean when we say psychological safety. Now, this term, psychological safety, has entered the sort of corporate vernacular very heavily over the past few years. You have Harvard writing, Harvard Business Review, Forbes, any major business magazine is talking about this topic. But this isn't a new topic because it was actually, there's research dating back to the 90s on the topic of psychological safety. So what are your connotations? I'll ask you to pause for just a brief moment and think, what are your connotations, or what kind of preconceived notions do you have when you hear the term psychological safety? What comes to mind for you? Certainly all of us have heard something or read something about the topic. Essentially, when we are talking about psychological safety, I hope that the connotations or the ideas or adjectives that came to mind or related to people. When we are speaking of the topic of psychological safety, we are essentially talking about the people, specifically people within your organization, department, or teams. It is a core function of a healthy and thriving workplace culture. And so when we mention psychological safety, specifically, the way we define it at Yes Wellbeing Works is that it is the capacity for an employee to show up authentically, make mistakes, push back, and seek support without fear of negative consequences. That's our internal definition of how we define psychological safety at Yes Wellbeing Works. Now, add a little caveat to that definition, specifically as it relates to support. That in order for an environment to be psychologically safe, it's not good enough for me just to be able to ask for support, but I have to reasonably believe that I will receive it. Now, I get it. Not all employee requests for support can be honored in the form that it was requested, but in a psychologically safe environment, there is a reasonable effort made to accommodate the employee through some sort of negotiated term or arrangement. And so that is what we mean when we say psychological safety. So keep this definition in mind as we move through the rest of today's session. So at Yes Wellbeing Works, we are an employee well-being company. We do that all day, every day. That's our main function. And the way we define employee well-being, psychological safety fits firmly in that overarching definition. For us, employee well-being is built on the foundation of basic needs, that employees are paid equitably from a total compensation perspective, and that they have all of the resources needed to be able to do their jobs. Once that's established, now we can build psychological safety. And I shared the definition of that with you in the previous slide, as well as belonging. Belonging is about connection to the organization's mission and values, but also connection through meaningful relationships with colleagues, of which, what we know from our research, the most meaningful relationship is the relationship an employee has with their manager. And then we have esteem, that employees feel that their contributions are recognized and valued. Collectively, that creates the culture for employee well-being, of which psychological safety is an integral and important component. And in the research that we do, all of these aspects are correlated, they're interrelated. Where one is high, we tend to see high levels of the other. So a lot of people ask, what is the difference between psychological safety and trust? Amy Edmondson was mentioned in the previous session. And so she is the PhD out of Harvard, who is one of many social scientists who have been studying the topic of psychological safety. And the best differentiation between trust and psychological safety, I heard her explanation of this. And so trust is about your willingness to give others the benefit of the doubt. Say you're in a workplace context and someone makes a mistake. We realize that that was a one-off mistake, that is not an indication of competence of the person. And so because we trust their ability, we trust the history that they've had of showing up and performing, then we do not assume a reputational sort of label as a result of that mistake, because I trust you. Well, psychological safety is about your belief that others will give you the benefit of the doubt should you make a mistake. And so trust is what we give to others, but psychological safety is our assumption of what others will give to us. So the direction is different between the two. I like to say that they are related, they're best friends, they're cousins, but they are distinctively different. And organizations looking to foster healthy cultures have the most influence over psychological safety, which can then in turn build trust in employees. Psychological safety is also a group level construct. It's not something that is only related to an individual on their island. It is about groups. So for example, it can be between an employee and their manager, two people. It can be between teams, maybe a group of people who are working on a common project, departments or organizations. So when we think about psychological safety, we're thinking about it at the group level, not the individual level. And just to show you how this plays out in organizations, when we go in and measure psychological safety, it's not uniform across the organization. Of course, we will have an aggregate level psychological safety for that organization. But as we start to disaggregate by departments or business units, we see that there are variations in psychological safety for different teams. For example, an organization that at the aggregate level has a really low level of psychological safety can have a department that has a significantly higher level of psychological safety, largely due to how that department is managed. Now, speaking about that, it's a great sort of segue into this next point, is that psychological safety is largely a top-down process. Think about it. Why is that? Why is psychological safety largely a top-down process? And I'm going to just do a quick pivot because I know that people were given a link to a Google form to ask questions. So I invite you, I meant to say that earlier, I invite you to ask your questions in real time. And if I'm able to get to them in the course of this session, I'm happy to do so. But I don't see anything just yet. So why do you think that psychological safety is a top-down process? I know it sounds really great to think that, psychological safety can be dramatically improved in the organization by those on the lower level of the org chart, rising up and creating this psychologically safe environment. But that's simply not the case. It sounds great for movies, real Shawshank Redemption-like, but that's not how it works in organizations. And that's for various reasons. For example, leaders in organizations tend to be the ones that make the policies and procedures. And they're also responsible for reinforcing those policies and procedures. They can also encourage desired behavior and discourage behaviors that are not desired, that may be counter to psychological safety. Employees look to them as sort of the models of what is acceptable and desirable in the workplace. And also, leaders and managers are the conduit by which employees fear negative consequences. Remember that last part of the definition of psychological safety. So people tend to fear negative consequences from those they feel have the power or authority to be able to produce those consequences. And leaders set the norms. And so inherent in this concept of psychological safety, there is a very distinct power dynamic that drives it. And for that reason, leaders matter a lot in being able to move the needle as it relates to psychological safety. So thinking about why you might care about psychological safety, I asked you a few questions in the beginning. Let me tell you about what some of the research shows as it relates to psychological safety. Academic level research, also our own in-house research that we've conducted, shows that psychological safety is correlated with an increased likelihood to disclose mistakes. So being an employee who makes a mistake, coming forth about it versus trying to hide that mistake. Also, interestingly enough, we look at the relationship between psychological safety and stress. And what we have found is that in teams, given similar workloads, when you have two teams, in teams where psychological safety is high, they tend to report lower levels of stress. We're still trying to understand causality. What is the sort of mechanism that explains that? But we believe initially that teams that have high levels of psychological safety are able to manage stress better in more healthy ways. Also, speaking up. The likelihood that employees will speak up when they know something isn't right, when they have good ideas, when they believe that the team or the project should go in another direction is greatly increased where you have psychological safety. I bet you all raise your hand when I say, who wants creativity and innovation? Well, psychological safety is absolutely necessary to be able to have creativity and innovation. Why? Because in order to be creative, I have to feel I can make a mistake. A mistake is one stop on the pathway towards innovation. Teams are much more likely to share information among themselves where psychological safety is present. And it improves overall group dynamics. I'll give you a real case in point. In 2015, Google did a research to understand why their teams worked so well and worked so effectively. I think the name of the research was like Project Aristotle. And the number one reason that they found was related to the psychological safety on their teams. Now, we all want Google level success. We all want Google level innovation, but are we all invested in doing the work to get there? That is psychological safety. And so in looking at some of the industries that you all are in here in the National Safety Council, those of you who are in manufacturing and construction, I bet the likelihood that an employee would disclose a mistake versus causing a lot of extra work, problems, and increased liability is probably something that you would value within your organization. Think about the makeup of those of you here in NSC and the work that you do. What's the cost of an employee who does not disclose a mistake? What's the cost of not being creative or innovative? For a lot of organizations, it's that creativity and innovation that is driving the margins of their profitability. What psychological safety offers, the gift of psychological safety, is that it creates a workplace environment that normalizes support, encourages shared responsibility, and fosters interpersonal interactions based on honesty. That is the goal of psychological safety. How does that sound for a place to show up to every day and work? So what I would like to do now is sort of pivot to a case study. I can talk to you all day about the work and the theoretical pieces of it. I am a social psychologist and we love theories, but I know that you're here for the real sort of nuts and bolts of it. So what I thought might be interesting is to share a case study with you, a case study with a longtime client of ours, Eastern Funding. So let me sort of give you a high-level overview of the work that we have been doing with Eastern Funding. You have some stats here. I am going to invite Nancy Robles, who is the president of Eastern Funding, on in a bit. And so Nancy has been with Eastern Funding, she corrected me, not 15 plus years, which I already thought, wow, that's a long time, but 18 plus years. And she has been in a variety of positions within the company, working her way up through various departments to be able to land in the role of president of the company. Nancy also is currently working on her doctoral degree in leadership and management. So that gives you a bit of a high-level overview of who she is, because she was really the key driver to connecting and reaching out to Yes Wellbeing Works to bring this work to the organization, to Eastern Funding. Eastern Funding is an equipment financing company, and they are managing over 1.5 billion in assets. They have about 110 employees. They recently also underwent a merger. For any of you who know about that experience, mergers are really challenging times for both the sort of acquiring company and the merged company. And Eastern Funding also has been, hold on, I'm trying to look at my slide here. Eastern Funding has also been working with Yes Wellbeing work since 2019. So they were actually ahead of the curve where a lot of people started to think about this work. And this was largely due to the leadership of Nancy. And so with respect to the work that we did with Eastern Funding, I'm not going to go over all of it, but just to give you an idea, I'm trying to set the tone for you to understand how we got to the work that we are currently doing in psychological safety. But in 2019, they started with doing work with relation to the annual survey. They wanted to better understand the overall employee experience. In 2020, they started, this was pre-pandemic, very early, before the height of the pandemic is what I want to say. They started training their executives on key topics of employee well-being, and then offering training support for employees in the area of mental health to help them now cope with what we were experiencing in employee well-being. We did pulse surveying in 2021 to see the changes in employee experience, continued training. 2022, more surveying and training. We added coaching to support employees. But then in 2023, that's where we shifted. We shifted that annual survey to Yes Wellbeing Works organizational well-being assessment. And that essentially looks at where the organization is in being able to support employee well-being. And we also added key training for their managers and leaders to be able to develop the skills of employee-centric management. With respect to the organizational well-being assessment, it consists of 4 components: a statistically validated survey tool where we measure each component of employee well-being, basic needs, psychological safety, esteem, and belonging. Our psychological safety scale, similar to the previous panel, is largely based off of Amy Edmondson's work. We tweaked a few of the questions and we have 8 components instead of 7, but we use that as the foundation. After that, we use the survey data, which is for all employees, to be able to give us the outline of what's happening. And then we develop focus groups based on that data. I tell people all the time, surveys are great for giving you the outline of what's happening, but the qualitative data, the experiential data, helps you to fully understand it. The OWA also includes a human resources audit, which looks at the internal policies and procedures in alignment with how they are either supporting or perhaps degrading overall employee well-being. And then it concludes in a final report and recommendation. That final report and recommendation for Eastern Funding uncovered that we should start with looking at a sort of overhaul of their job descriptions, making sure every employee had an update and active job description. Job descriptions are important in terms of basic needs, that employees understand what's expected, but also for psychological safety. Where there is role clarity, there tends to be higher psychological safety. We also had one-on-one departmental sessions with key departments that needed additional support for psychological safety. And then we also had management and leadership coaching and training to be able to support the effort. Our findings: we had 2 departments where psychological safety significantly increased. We also had 2 departments where psychological safety decreased. And Nancy will get into this in a little bit, but this work is dynamic. It's not a one-stop shop. It is something you continue to have to work on and adjust. And small shifts or changes in departments can have a large impact. We did have a key business unit where we were concerned that the psychological safety would further degrade, which remained stable. And we count that as a win considering the challenges in that business unit. Also, managers' competencies and a capacity to manage and support employee-centric management skills increased. And so those are our current results to date. What I would like to do now is well, let me pause to see if there are any questions in the Google Doc. No questions yet. I'm going to refresh just to make sure. Oh, wait a minute. There are questions. Hold on. All right. So here are a few. Let me try to answer a few questions and then we'll pivot to Nancy for the last 20 minutes. Examples of behaviors or practices that contribute to a psychologically safe workplace. Yeah, that's a great example. So I gave a few. Role clarity can contribute to a psychologically safe workplace. Also, employees understanding the level of interdependence of their role with their colleagues. From a manager's perspective, key drivers of psychological safety are that managers are open and available to hear concerns, that they're open to new ideas, if that gives you some examples. You mentioned that psychological safety comes from the top down. Can an individual who is not a leader create psychological safety, or does it need to be a common goal for all involved? Yeah, that's a great question. But I really commit to the fact that you need leadership buy-in to create psychological safety. Why? Because policies and procedures within the company are key drivers of psychological safety. You also, in terms of values, what is rewarded and what is discouraged, that tends to come from leadership. So I definitely think non-leaders can sound the bell, but in terms of making those structural changes, you need leadership buy-in. Do you need every leader on board? No, but you can make incremental adjustments and shifts with those who are on board and gain momentum. I'll answer one or two more questions because I want to pivot to Nancy. How can leaders model and promote psychological safety within their teams and organizations? Yeah, that's a great question. And so unpack that definition, that an employee can show up authentically, push back, make mistakes, and seek support without fear of negative consequences. How do those things play out on your team if you're a leader? When employees ask for support, what's the response? When someone pushes back, even against your ideas and even against decisions that the group is in alignment with, is that received? Is it viewed as something that is negative? Also, creating multiple mechanisms for feedback is really important as well. Because if you don't have a psychologically safe team, then the likelihood that an employee will come to you and be forthcoming is greatly reduced. But anonymous mechanisms for feedback, or mechanisms for feedback that don't require me to stand up in a meeting and share my concerns, are some examples of how that could look for a leader. All right, I want to pivot to Nancy and ask her a few questions, and then we'll come back if we have additional Q&A. All right, Nancy, welcome on board. Nice to have you here.
Hi, thank you. I'm so excited to be here.
Yes, thank you. So I want to ask you a few questions and sort of give us your feedback on your experience and perspective. So Eastern Funding started working with Yes Wellbeing Works in early 2019. As I explained, to formalize your annual survey, and we expanded our work from there. What caused you to be interested in supporting employee well-being at Eastern Funding, considering you were well ahead of that sort of pandemic curve where more organizations got on board with this work?
Well, there were a number of things that contributed to the interest in creating a psychologically safe environment for everyone. I think one of them is that I didn't start as a leader in this organization or even in finance. I started a very entry-level position at Eastern Funding 18 years ago. So I have the experience of an employee, right? It's especially someone who was kind of a little disruptive, wanted to change things around. And so I needed to create an environment, or I have the experience of wanting to create an environment where I feel safe, especially as a woman in a male-dominated industry. Also, in my studies, when I got my MBA, I spent a lot of time learning about the human experience, human resources, and then later, now in my doctoral program, I have spent a lot of time learning about the experience of the human and how our belonging and safety and how that impacts our interactions, our experience, our innovation, all that. So in learning and being very interested in the human factor, I became interested in the work. And so I was able to recognize early on that it was definitely an area where if we focused as an organization, we would have great results. Other aspects were that when we did the initial survey, which was, we want to know how we're doing as an organization. Is it a great place to work? The results told us that there was more work to do. And that's the whole point of the survey, right? If the survey is of no use unless you take action. So it gave us guidance. It created a pathway for us to start working on. And also, I think that, that's why we were ahead of the curve. But then when COVID happened and we started seeing the results and how it impacted people, impacted me, impacted everyone, we recognized that we needed to do more. And so it was important that we moved in that direction. And luckily, we had an established relationship with you. And yes, well-being works. So we were able to quickly get something going.
Yeah, you were one of the fastest clients who pivoted really quickly to bringing in this work right at the peak of the pandemic. So here's a great question for you. How did you get buy-ins from other executives at Eastern Funding who maybe weren't as dialed in as you are in the human experience and the employee experience? How did you get them to buy into this work? That's a question I'm sure a lot of leaders who may be well-intended are wondering. How do I bring my peers on board with this?
Because the challenge of getting everyone, you need everyone's buy-in at some point, or at least the people who are most influential, because there's a cost associated with it, right? So how do you get people to recognize that it's an investment, that it's a great investment? It's one of the most important investments you can make. First I had to get, the most important person I had to get on board was my CEO. And luckily he and I are always aligned. It's just a quick story. At some point in 2021, we had a company meeting. And if you're familiar with finance companies, you talk about profit, interest, where our originations is all numbers. But this one time he and I discussed it and decided that we were going to focus on the human experience. And all we talked about was what people were experiencing. We invited employees to come in and talk about, someone talked about experiencing loss of family during the pandemic. Someone talked about the challenges of parenting and having kids at home and juggling work. I talked about a terrible divorce that I was going through COVID. So we try to normalize the conversations around challenges, trauma, human experience, mental health. So he and I have always been very aligned in that. And so I'm very grateful for that. As far as the other executives, a lot of it was showing data and showing research, proving that it is a real thing, that if people feel like they belong, they feel safe, they feel that there is psychological safety within the workplace, we're more innovative, creative, they're more likely to challenge the status quo and fall forward, as they said, right? People always say, oh, falling forward is a great thing. Well, it's not if you're scared that if you fall, no one's going to pick you up. So it is important that and so as we were able to articulate that and show how that can translate to benefit for the organization, then we were able to get more people to buy in. And you don't always get everyone, and that's okay. As long as you don't need them, as long as you can still make the executive decision to go ahead and make the investment, you're fine. And, what I will say is that a lot of times, even when people are not fully buying in, but when they see results, they will get on the train with you. Mm-hmm. And people do see the results, especially when employees talk about the organization with a very positive connotation. They say this is a great place to work. They're committed for life. Then, you're doing a good job. And then, also, just the research itself. Like I said, the surveys over years, we've seen different results that tell us whether we're moving in the right direction or not. Do we need to pivot? Do we need to make changes? Do we need to tweak what we're doing? So you're really having that data at your fingertips and being able to show the other executives, look, we got a great review in this, or we got great responses to this, or we need to do better here, then that definitely impacts their decisions.
Yeah, that's a great point about the data. What we've noticed across clients, particularly when there are executives who are not fully on board, we go in, we do the analyses, and we show them the results for their team, and they're flabbergasted. They had no idea their teams felt this way. And that's not uncommon, because particularly if you're at the top of the organization or the department, you may be quite detached from what the experience of your team is. And I know that's not the case with you, because you tend to stay very grounded with your direct reports, but that's not always the case in a lot of organizations. In fact, there's even research that shows that the trend tends to be the higher up the org chart that someone goes, so the higher they climb, the lower their emotional intelligence tends to get because of that detachment. And so sometimes that data is the only thing to sort of root them back in the reality of their current department or organization. And so that's a really common trend.
I will add, though, that the delivery of the data is so critical, which is why I often ask you to deliver it, because the way you articulate it, the way you explain it to them, they receive it much in a different light than if I deliver it, or I just give them the actual numbers. Hearing it from you and the way you explain it, and the way you're able to interpret the data, I think is critical as well.
Sure. Yeah, that sort of external perspective.
Mm-hmm.
Next question. So from our organizational well-being assessment, a lot of things came up, and we always try to focus on where we feel the most valuable area of focus is for an organization. And for Eastern Funding, we decided for 2023, we would focus on psychological safety as a key opportunity. What were some of the challenges that you experienced, heard of, or witnessed as we work to improve psychological safety in the organization?
Well, first of all, this work, like you said earlier, is dynamic, right? It's a constantly changing, evolving thing, right? We're humans. You know, I had a great day yesterday, maybe today is not so great. And that's the same thing with an organization, because it's made up of people. And so you're not always, it's not a one-time thing. It's definitely something that you're on. It's an ongoing work. Things fluctuate, people leave, you get new people, dynamics change within departments, or even, life experiences, right? What people are going through in their personal lives impacts how they feel about work, colleagues, so on and so forth. So it's definitely an ongoing thing. Sometimes, for example, we were completely remote for 2 years, and then recently we said, okay, we need to come back, not fully hybrid, but we still had to make that change. And so not all employees are on board. Not everyone's thrilled with that change. And I want to know how people feel, because in some cases, some people are vocal. In some cases, people aren't, they feel safer in the survey where they can give their opinion. And so that's why, right, you want to give them every avenue possible to be able to give you feedback. So while I always say my door is open, call me, everyone has my cell phone number, it could be a private conversation, or, but also they sometimes feel that they want to express how, whatever it is that their opinion is in a different way, in a different format. And so that's why the surveys are so important. It allows them to do that. But there's unpopular decisions sometimes are best for the organization. And so we want to manage all those things. And so I know that the remote thing was not easily received. We had to make some different decisions, like expand the amount of time that people had to come back. How many days do we want people to come in? Why? And communicate that, right? And it took a lot of intentional communication, a lot of instead of having company meetings where I spoke to everyone at once, I had to meet with different departments, explain why it's important, why we want to be intentional about how we spend our time. So things of that. So there's a lot of ongoing different areas that impact the psychological safety or how employees feel at any given time. So it is a constant ongoing effort to make sure that we know what's happening and how people are feeling. And as much as I try to stay involved, we've grown enough that I don't have one-on-ones with everyone regularly. When we were 25, 30, 40 people, I had personal information, personal relationships with every single person who worked here. Now there's 110 people. There's people that sometimes I don't see for, long periods of time, also because of the nature of my work. So this gives me, keeps, my thumb on the pulse or.
Right. Let me ask you a question. I was very transparent in the results that we saw, and we had two departments, one of which is Eastern Funding's key revenue generator, where psychological safety increased in their sort of compliance area, that team where psychological safety increased, but we had it also decrease in some teams. And so what do you think the challenges were from your perspective internally of that sort of unequal improvement? Because most people think this work is a linear process. And so what comes to mind for you with that?
Well, definitely the going back to the office, I think impacted some of those departments, that 100%, because I did get some pushback and we had to work towards getting to a place where we all understood across the board what was the benefit of going back. And we're not going back fully. I had to also articulate that. As long as I'm president, we're never going to be full-time in the office 5 days a week. However, we do need some time together as teams. And so definitely that was part of it. Recently, we had some unfavorable audit findings that meant that some of the quality of the work was had to be improved. So I think receiving that feedback for those departments was difficult. And I think for this, the reason why and the other department was increased their scores so much is because that leader had in the previous survey had lower scores. So he was very intentional about changing the environment. Also the training. I'll tell you that the feedback that I received from all the leaders that were involved in the training that, with your organization, the feedback was very positive, because not only were they trained on how to create psychological safety within their own departments, with their own direct reports, but with each other. It's interesting how the dynamics are within departments. It's like, oh, they're doing something different. That's not fair. But, there's so much, right? Humans are so complicated and layered. And their interaction during the trainings and finding that they had so much more in common than they realized. They were all the same challenges, and having shared language that they learned in the trainings together was so impactful. But yes, back to the original question is, I think there were some specific business decisions and outside forces that created pressure in those departments that made people feel they weren't thrilled about what was going on. While in the other departments, the leader was very intentional about applying some of the skills that he learned from your training. And so I think that was what helped.
Great. And my last question for you before we move to a broader Q&A is, what benefits have you seen as a result of Eastern Funding's work in psychological safety?
Well, so much. I'll say that we've had at least 3 different employees who have experienced mental health challenges that were able to go to their managers and say, hey, I'm having a challenge, I need assistance. And that translated to, time off, leave, and being able to talk about it and get support and asking for, I've even had people ask me, how do I find a therapist?
Mm.
And, you know, and I've been able to give them tools or, you know, give them our information from our parent company that we have different resources where you can find your mental health help. And so, you know, creating an environment where people can actually talk about it and it's normalized conversation and they know there's no stigma, that it's not going to impact their ability to be promoted, impact their ability to get raises or whatever it is, right? Opportunities within the organization. Yes, yes, that's everything. Because if you're able to show up and say, hey, I'm struggling, I need help, even if the organization doesn't have the resources you need, but just to be able to have that conversation and feel safe about it and understand and know that the person receiving what you're sharing is going to be able to still look at you in the same way. It's not going to hold that against you. It's not going to impact you in the future. And they understand that it's a temporary thing like everything else in life, right? That's critical to the relationship. And but you know, being able to ask for help, not having the stigma or the negative consequences that people often fear, and also creates a safe environment. Like I said earlier, being able to fail forward, right? You can't be innovative unless you feel safe enough to make mistakes. You know, people always want the innovation, but they don't want the mistakes. And you can't do that unless you feel safe enough, unless you know that it's not going to be held against you, that it's not going to be an environment where you're going to lose opportunity because you had to make mistakes in order to create something new. And so, you know, I often say that you can't fall forward, as people so often say, don't be afraid, do it, you know, but you can't do that unless you feel that it's safe enough in a safe enough environment. And you know, and it was also, you know, we had this merger that we talked about, right? And so being able to take the culture piece, which is very much rooted on psychological safety, right? Because culture that's why the leadership impacts the ability to have psychological safety, right? Because it's all about the culture. Do we have a culture that's all about the money and the profit and the bottom line? Or do we have a culture where humans are valued and their well-being and that they feel that they're seen and heard every day when they come into the organization? And so creating psychological safety and having, you know, that's what the culture is all about at Eastern Funding, where we recognize that if the human is able to be their best version because they feel safe enough to be themselves, to be authentic and share who they fully are, then we get the best results possible. That will translate to everything they do. And so, you know, when we did the merger, it was important that we focused on that as well in terms of the integration of the groups.
Awesome. Thank you. Can I ask if they bring the slides up one more time? Awesome. So we're going to move to the Q&A, but I wanted to just put this slide up here with additional resources if anyone is interested in learning more about this topic. We have a white paper that details our findings in employee well-being and how it's different for different demographic groups that you can learn more about. There's also a session on trauma-informed workplaces, which I call Psychological Safety 2.0, that you can watch, as well as additional readings and insights on the topic that can help you further your learning. I know this is just a snapshot, and we've been working with Eastern Funding under Nancy's leadership for several years, and so it's not expected that you're psychological safety gurus after this, but hopefully this has served you in some way. All right, so I think we're passing to the Q&A now. I have a few questions still in the Google Doc, but not sure how we're going to do the Q&A. And
I'll jump in here and say, one, thank you both. This is a great discussion, and we really appreciate having the real world examples, which I think is so powerful. And Nancy, I really appreciate what you said about kind of failing forward, because I think that helps to make the business case for why this is so important, that the innovation that you can get from psychological safety is a real business value, and why you should be proactively investing in this. So one of the questions from our audience was around psychological safety and how it intersects with diversity and inclusion efforts. And how can organizations ensure that all employees, regardless of background, feel psychologically safe at work?
Sure. So I'll respond from my perspective, but Nancy, I know this is another one of your key focal areas, so I'll let you respond from your perspective too. And so I tell people at Yes Wellbeing Works, we are an employee well-being, and so that is our lane. We don't do DEI work per se, but we care about a lot of the same things like psychological safety and belonging. And so that is where it intersects. And also, if you download that white paper, it shows you that psychological safety is not the same across all demographic groups. When we look at the data we've collected over the past 2 to 3 years, and we disaggregate by race, for example, in white and non-white populations, non-white employees report lower levels of psychological safety than white employees, specifically in their belief that they have the capacity to make mistakes without it being held against them or to show up authentically. Women report lower levels of psychological safety than men, specifically in their belief that they can present new ways of doing things and that it's received. And so this work is definitely, there's a cross section between it, but what DEI is sort of doing in their contribution to workplace structure, they are trying to look at how do we get more diverse bodies in, how do we support them holistically once they're in the organization. And so I'll sort of pause and then sort of give Nancy her opportunity to comment, because this is also an area that Eastern Funding has been really focused on.
Yes, this is my other passion, actually. And I'll tell you, I previously talked about being being an employee and then rising up to the leadership level. And I'm a Hispanic woman and in a very white male dominated industry. And even the industries that we serve are very white male dominated. And so my experience personally has always been, that of a woman of color, that perspective. And so that has made me super sensitive to the DEI component. Also, I'm the only woman and minority on my executive team. So I'm very conscientious of the experience of being able to be part of a team where there's psychological safety. And it absolutely is, there is definitely a direct connection between having psychological safety and being able to have a true, diverse, equitable, and inclusive workplace where people feel like they belong. Because if you don't have psychological safety, and particularly like if you're an only, but definitely if there's diverse or people who are from underrepresented groups in a room or part of a team, if they don't feel that they can show up as their authentic selves, if they don't feel like there's enough safety for them to be able to be who they are without feeling the pressure of representing an entire group of people or the experience of tokenism or any of that, then it defeats the purpose of having any diversity. Because the reality is that people, if you don't feel safe, you would just assimilate into the major group and your voice is unheard. I mean, there's statistics that say that unless 33% of the team represents underrepresented groups, or it's made up of people identify as diverse, then the voices are just kind of, are lost. Mm-hmm. So the reality is that you have to have psychological safety. Like that is the foundation for DEI work.
Well, there's such a big intersection to the topic we were just talking about. So really appreciate you both diving into that. And you were making a great point in the earlier discussion about job descriptions and the importance of understanding roles in psychological safety, which brings up a great audience question, how you integrate psychological safety into hiring practices, such as when screening or interviewing applicants. So we'd love your perspective on psychological safety and interviewing.
Yeah, that's a great question. And so thinking, I always go back to that basic definition with respect to be able to show up authentically, make mistakes, push back, and seek support without fear of negative consequences. And one of the things that comes to mind that's really top of mind in the work we're doing is how do you interview neurodiverse candidates? in a way that is psychologically safe, or candidates that may have other disabilities, but physical or invisible. If they ask for an accommodation for that interview, are they sort of low-key deemed not a good fit anymore, or are they welcomed as a valid candidate that you saw on that paper or resume? How do you interview? A lot of times, particularly for neurodiverse candidates, and particularly those on the spectrum, the typical ways that we interview don't serve them or allow them to fully show their full capacities. You know, a lot of interviewing is highly performative, and what is deemed as successful performance is rooted in understanding the social norms and cues that may not always be apparent for neurodiverse candidates. And so is there a better way to interview candidates instead of having behavioral based interview questions, which is really the norm? Can they demonstrate instead of having to explain, for example? Can you prep them and they have the questions in advance to be able to think about them if they're neurodiverse and may need time to reflect? And so I think that the biggest question and sort of authenticity is, who is this recruitment process designed to serve? Is it designed to serve a very specific type of candidate, or is it designed to serve a diverse array of candidates where we are communicating from our employee value proposition, how we're branding ourselves to this candidate, that all is welcome here, that there is support without judgment for candidates and employees alike?
And that's a really good point about how do we think about our broaden our pool of talent, because I think there's a lot of importance on building talent for building workplace success, as Nancy was mentioning, finding innovation and different ways of thinking.
Well, if I may add, I'm sorry, if
Please.
I may add to that question, one of the things that I personally have found is that educating the people who are doing the hiring. I'm very sensitive to this topic because I have a son who's on the spectrum and who has ADHD. And so I'm very aware of the different dynamics when having interactions, social interactions with people who have, other abilities. And, I have someone at the company who, during the interview process, it was evident to me that this person was possibly on the spectrum or had, some kind of other abilities or challenges or whatever it may be. However, I don't want to categorize in any way, and so it was ultimately, we did ask questions in a different way once we were in the interview, and I recognized that I needed to interact with him in a different way. And then there's a test component. And so we were able to not follow the traditional path that we normally follow of the behavioral questions and sort of pivot and adjust to be able to accommodate this interview process. And this person has been with us for 6-7 years, and he's amazing at his job. But I know that if we had not been equipped to be able to adjust quickly and ask different questions, or continue to ask the same question in different ways and sort of create a more comfortable environment during the interview process, it would have definitely had different results. And I think that applies for for people from any different background or experiences. I think being able to identify that even experience, for example, in finance, there's very specific credentials that people look for. And someone, for example, like myself, who, I grew up in an urban community, I'm from an immigrant family, very non-traditional, my credentials are very different. And so because I'm aware of that, I've hired people whose credentials didn't look like what recruiters say credentials should look like, but they've been very successful at Eastern Funding. And it's just because they have different life experiences. And so, they look different on paper, but their skill set is still amazing. And we've created an environment where they can thrive.
Well, and that's something that we say at Health Action Alliance a lot. Good health is good business. And so having the ability to be psychologically safe can really strengthen the business's bottom line. I think that's a really critical point when making the case for this investment. One of our audience members asked a question about, are there kind of specific skills or competencies that you can point to that employees can develop to contribute to a psychologically safe workplace?
Sure. Excuse me. Sure. So, in thinking about it first as a management or leadership imperative, I mentioned some key behaviors of managers that track with increasing psychological safety, that managers are open and available when you have concerns, that they are also open to hearing new ideas or different perspectives, and that they show some malleability in their idea. Being open to hearing new perspectives doesn't mean I will listen, but I'm not changing my mind. That's not the goal here. The goal is that they are open to their opinion being changed when presented with different data. Also modeling vulnerability. I think we are learning that a little bit more than we have in the past years, that, managers can't say, do what's best for you, but then they sort of set the norms at a different tone and expect that employees aren't looking to them as an example. And so admitting when they don't know the answers, or they need support, or they made a mistake. Now it gives permission for employees to do that too, without fearing consequences. And to be clear, when we say fear of negative consequences, what we're finding that what employees are fearing the most is not being fired. It is that those interpersonal negative consequences of reputational risk, of being ostracized, or not being able to be on a choice project or opportunity. And so when managers model that, then that gives employees permission to also show up and be vulnerable. As a peer, think about support. When your colleague reaches out to you for support, is your response always no? Do you frown upon it, or do you try to support colleagues in the way that you would also want to be supported? If you are a person within the organization who is always listened to, do you create space for those who may not always get to have an opinion, or whose voices are not always valued in the workplace? And so those are just a few examples.
Well, and one of the questions that to kind of build off of that is, for people who have been trained and who are trying to be supportive, how do you support and educate employees who aim to be there and aim to be supportive, but don't follow through? And kind of your point about not doing all of the things that they need to do to actually create psychological safety in the workplace.
Yeah, this is the thing. I know, the research shows that most people are self-interested. And people hear that, they're like, oh no, not me, but it's okay. What that means is that most of us don't do things that will harm ourselves. And everyone, when they show up and do things, they have a reason that they are doing it, and a reason that either makes them feel good or has some benefit. And so I think sometimes we don't always connect the dots for people in terms of what this work can do for what they also want in the workplace context. You don't have to be fully bought into the concept, but are you fully bought into your team knocking this project out the park? Are you fully bought into the idea that you increase the bottom line? Are you fully bought into the notion that you meet your sales commission and you bring home that fat bonus to your family? If that sounds good, let's walk it back to what the actions are and why I need you fully engaged in this. And so I think that sometimes we expect people to do the right thing because it's the right thing, and that's not always the case. So it's completely a good idea to sort of figure out what their self-interest is, to be able to motivate them to commit to it versus just checking the box.
If I may add, I think I always say that being vulnerable is a superpower, because it's the scariest thing in the world, is to show up as your full self. And even as a leader, right, there's all this pressure to be perfect. You're supposed to have all the answers. But being able to show up vulnerably and say, I don't know, it's scary, but it creates a safe environment for everyone else to say, I don't know, I need help. I think also a lot of it is through the years, we've been we've been sort of programmed to think that being tough is the way leaders were supposed to be. And maybe that's the way it was in the past. But modeling that behavior doesn't work anymore, that's not what leadership looks like anymore, right? That, it's my way or the highway. It's not the way to go. And that because we've changed culturally, we've changed as a society, because we just went through this very traumatic event of COVID and other traumas that have happened, that we're in a different place as a society. And as a leader taking that leap forward, I think that as scary as it is, once people see you do it as the top of the organization, it really trickles down and impacts everybody else. And it's such a relief to be able to be yourself. Everybody wants to be themselves. They're just scared.
Right. Well, we have one final question, and it connects to, we're here for the National Safety Council, and there's a question about psychological safety and how it connects to overall safety culture. So could you maybe provide a final thought about psychological safety and overall corporate safety culture?
Yeah, that capacity or likelihood to disclose mistakes and to speak up. I mean, if that is not, direct one-on-one correlation, connection to what you care about, then I don't know what is, particularly in the manufacturing and, God forbid, construction industry. If employees make a mistake and try to hide it, what is the cost and the liability of that? And also, if employees know something isn't right or see something that isn't right, but are fearful to disclose it, what is the cost of that to you for your organization? So those are two things that come to mind for me.
That's a great way to close this segment. So thank you both for sharing your expertise on this topic. And thank you, Nancy, for sharing the real world case study. This is a fascinating discussion.
Awesome.
Thank you.
Pleasure.
Welcome back. Hope everyone had a chance to stretch and recharge as we shift to our next panel, where we will hear from experts on getting ahead of emerging diseases, pandemics, and future emergencies that can affect employers. We'll hear from 3 speakers and then come together as a group to engage in additional conversation. So to be sure to pop your questions in the Q&A box. So first up, Dr. Lisa Kunin, founder of Health Preparedness Partners, where she provides consultation about planning for and managing infectious disease outbreaks and other emergencies, helping companies to update emergency response and business continuity plans and more. Following Lisa will be Dr. Kenneth Mead. Dr. Mead is a mechanical engineer and industrial hygienist. He has over 30 years of experience and recently provided support in the development of CDC's controls and protective ventilation guidance. Our third presenter is Aman Patel, holds a BS in computational neuroscience, and is the executive director of Technologies for Pandemic Defense, a nonprofit working to accelerate the development of biosecurity technologies using market-shaping mechanisms. First, we'll hear from Lisa, and once everyone presents, we will dig into Q&A and come together to answer any additional questions.
Thank you so much, Mark. It's really a pleasure to be here today. I want to take this time to talk about pandemics, which is something that people are a little tired of hearing about, but we all know that we were in panic when the pandemic hit. No one expected the kind of disruption that we saw, but it really changed our work environment. And I think we've shifted from panic to complacency now. The COVID virus is still circulating. It isn't over, but even the most wary of us are ready to move on. So what does this mean? We all want to put COVID-19 behind us. But if we don't take the lessons learned from this recent experience, then we will be less prepared next time. And experts agree there will be a next time. Another pandemic will happen. Not maybe, we will experience it, but we don't know when and we don't know what. Since 2003, there has been an acceleration in disease outbreaks across the world and multiple global outbreaks. We've seen this pattern speed up over time. And the World Health Organization has identified diseases that could cause a future outbreak or pandemic. And among those is what they call disease X. And that's what COVID was. Disease X is something that would cause an outbreak, but we really don't know what that pathogen would be. And so we need to be prepared for the known and for the unknown. In order to start thinking about this, I'm going to suggest that we look back to plan forward. And what I mean is think about how your organization did during the COVID pandemic. Were your plans effective? Have you talked to people in your company to understand what the experience was? And given the lessons learned, what would you have done differently if you happen to find that you're in this situation again? I'm thinking that there are lots of lessons learned that are still uncovered. Maybe you've interviewed some of your staff and leadership to talk about what transpired, but if you haven't, it's not too late to do that. And taking those lessons learned into serious consideration for how to update your business continuity plan will make your business continuity plan more resilient going forward. And then conducting exercises to test those updated plans. So you don't have to start from scratch. Most businesses already have plans for business continuity. A pandemic plan can be an annex to that. And the reason why I feel very strongly about this is because employers play such a critical role in both pandemic planning and response. The number one focus is on protecting employees' health. And we learned through the pandemic that human resources policies, if they're aligned with public health recommendations, can go a long way to protecting employees and the community. In particular, flexible and non-punitive sick leave played a very big role in reducing transmission at the workplace. In addition, workplace policies, environment, such as space, the importance of ventilation. We learned so much about the importance of a healthy air environment and the role that HVAC systems play. My colleague Ken will be talking more about that in this session, and cleaning, as well as policies that adhere to public health guidance, such as mask and PPE. My colleague Aman will talk about that, and vaccination. We also know that businesses play an important role in providing critical products and services for the community and serve as community leaders in collaboration with public health and emergency management. And finally, can contribute to the response and to the recovery. So planning for a future influenza pandemic or a COVID pandemic or whatever it's going to be pandemic, the key question is, do you have the right plan? Do you have the right team? And do you have the right policies in place? Because it's important to be able to launch your plan on day one. So planning for a future disease pandemic includes a number of items. And I'm just going to review these in detail with you. The first one is an ongoing threat monitoring. In other words, you're probably tuned in to weather threats, civil disrest, other kinds of things in your community that might pose a threat to business continuity. But are you tuned in to whether there are health threats that could compromise your business continuity? And where would you get that information? It's very important to tap into reliable sources. The CDC, state and local health departments, the World Health Organization. These are places that you can find information to inform your planning. Those of us that were tapped into reliable sources knew in January and even the end of December that there was an unexplained pneumonia going on in China. Wonder if your business knew that there might be a pandemic as early as January 2020. How would that have informed what you did? Would you have been better prepared? Secondly, is updating your business continuity plans to include planning for infectious disease threats. We've already learned that responding to a pandemic is very different than responding to other business continuity threats. So it's important to update your plan. Finally, it's not enough just to have a plan on paper. You really have to breathe life into it. You have to see if it will work. And in doing that, you do exercises, drills, and simulations. It's just like a sheet of music. It's got notes on it, but until you play that music, you really don't know how it sounds. So exercises are a critical part of not only business continuity for other threats, but also for a pandemic. And finally, it's important to create flexibility within your plan. No one could predict that COVID was coming, or what it would mean, or how the virus would change, or the fact that we got public health guidance that also had to change over time. And so we had to pivot over and over and over again. If you construct your infectious disease pandemic plan with the advice that we will have to pivot, we will have to change, that will be a more realistic plan for your company. But by having these plans in place, you have a starting point on day one. And that's what's critical, so that you don't get caught off guard. It's really important to also practice by leveraging everyday opportunities. We're in the middle of flu season, and you can see on the map on the right from CDC that flu season is starting to affect many states. Thousands of people have been off of work because they're sick with the flu. Millions of people have caught it, and there's been hospitalizations and deaths. So this is an opportunity during flu season to do two things. First of all, to encourage people who are sick to stay home. Anyone that has respiratory symptoms or a fever, or they're just not feeling well, they really don't need to come into the workplace because they will infect others. And that's the same rubric that we'll use during a pandemic. So we can practice that during flu season by encouraging sick people to stay home. And also, employers have a big role in advising people to get influenza immunizations, vaccination. It's not too late. And in fact, the holidays are coming up in a few weeks where people are going to travel and gather. And we see a spike in flu every year right after the holidays because of all the exposures. When people are vaccinated, they have a much fewer chance of getting ill. And that can also be a practice for your pandemic plan. We've been talking about preparation, but I want to end by talking about a successful pandemic response, because it's not only the preparation that you do that gauges your response, but it's important to have leadership all the way to the top of the business. Leadership in the community and leadership in government, but also leadership in businesses and organizations. Communication, we learned, is very important. Can you communicate with all of your employees at any time of day to give them information, advice, or guidance if they need it? If you don't have a way to do that now, consider using platforms that are out there already that can help you to communicate with your staff. Flexibility. We talked about the need for pivoting. It's also going to be important as you train people and do exercises to emphasize that point. And a layered approach. And what we mean is, when it comes to fighting a health emergency, there's no silver bullet. There's no one thing that will make it all better. Rather, we have to deploy multiple strategies at the same time. So an analogy is like a piece of Swiss cheese. One piece has lots of holes in it, but if we layer one piece on top of the other, the solid places in one slice block the holes below it. And we've used that in pandemic planning because we know that while vaccination is important, it's not good enough. While keeping sick people home, it's not good enough. While wearing masks can be very effective, by itself, it may not be enough. But when we bundle strategies together, we can get a very effective response. And so incorporating a layered approach in your plans is going to be important. So, you know, my crystal ball is not very clear about what the future will bring. But what I do know definitively is that preparation is needed. And I'm encouraging you to think about what your preparation is for a pandemic. I've really enjoyed talking with you today. The 4 principles that I outlined are available to you in an ebook that I recently published, and you can go on either the speaker page or the research tab in this website, and you can get a copy of the book free and no charge. And I look forward to the panel discussion with my colleagues. Thank you.
All right, thanks, Lisa. I am going to talk about the CDC's COVID-19 ventilation guidance, and got a lot to cover today, so I'm going to get right on going here. And I'm going to be joined at the end of the when we get into the Q&A session by my colleague Steve Martin, as well as also from CDC NIOSH. These are my obligatory disclaimers. If I say something wrong or appear to contradict CDC guidance, I have made a mistake. I will not be announcing any new guidance statements here today. I'm also not going to be endorsing anybody or vouchering or endorsing for anybody's websites. Now, CDC updated in May of this year, and they released 2 ventilation guidance updates. And when they came out, they caught a little bit of attention from the press, mostly because of 2 primary activities. One was, for the first time, CDC recommended a health ventilation target outside of the realm of healthcare, but for the general occupied environment. And there was, we resumed a minimum filtration efficiency requirement as well, and I'll get to those here shortly. The CDC COVID ventilation updates, before I get into them too deeply, a little miniature toxicology refresher. We can look at contamination either through the air or on surfaces. And you see there that in both cases, however, the variable of concentration exists, and as does the variable of time. Well, time's an administrative function, but the concentration we can somewhat control through the use of engineering controls. And so that's what we focus on with the ventilation guidance. So ventilation has a lot of different meanings to different people. For the purposes of our webpage, we're referring to indoor air movement and dilution of viral particles through mechanical or non-mechanical means. We're looking at filtration through central heating, ventilation, and air conditioning. And we're looking at air treatment through UV, ultraviolet germicidal irradiation, UV also called GUV for germicidal ultraviolet. And when I talked about the filtration through central, I should have mentioned or through portable systems as well. There were 2 products that were actually released on that date in May. One of them was an update to our existing ventilation in buildings document. And then the other was a new document entitled Improving Ventilation in Buildings. And I'll discuss those in greater detail. The original document, Ventilation in Buildings, was one that had actually existed in one form or another since about May of 2020. And it had undergone a few updates over the years, but it had not been updated since June of 2021 at this point. So since that last update, we had had a lot of feedback from different persons that came in. We had had new and evolving guidance that also existed from different organizations that we're able to incorporate into our guidance. We had evolving knowledge on the science of transmission. And then there were opportunities to address some new, update some existing FAQs, as well as to insert a new FAQ. And that's based on this continuous flow of questions that would come into us. The new document was entitled Improving Ventilation in Buildings. And that particular document was, it's only about 2 pages, maybe 2.5 after the graphics were inserted. It has a totally different audience. It's located in a different part of the CDC web guidance. It's looked to be more of a layman's audience, but yet it still will link back to the main Ventilation in Buildings webpage. It's intended for use with the lay audience as a tool for understanding or guiding conversations about ventilation improvement options that can help building occupants identify what questions to ask of their own building owners or managers. And it also serves as a simplified summary of the CDC ventilation guidance for those who want to incorporate ventilation intervention topics into their messaging. Within the improving ventilation, again, it's a rehash of much the same guidance that's in the larger document, but discussed in a more simplified terms. But the first thing we talk about is knowing how your building system works, ensuring that it's operating as it should, and it gets regular maintenance as it should, and then consider improving or upgrading your system to whatever the current code requirements are. We talk about increasing air filtration in your HVAC system, using MERV 13 filters or higher that fit well within the filter rack. We talk about using air cleaners, also called air purifiers, with high efficiency filters, and to select one that's the appropriate size for the use of your space. If you have a very large room, having a little tiny system that sits on a desk somewhere may not be appropriately sized. And then we also talk about aiming for at least, so a minimum of 5 air changes per hour of clean air ventilation. Also, options at times are to do things like bringing in fresh outdoor air into rooms when the outdoor air is accommodating for that. You can do that through opening windows and doors. You can turn on exhaust fans and other fan sources in order to improve airflow within the space and improve the incoming air. To turn your thermostat to the on position when you're occupied. If your thermostat thinks that the room temperature is okay and it throttles down the ventilation to 0 or some minimum setting, then you're not getting protective ventilation during that phase. So you want that ventilation to continue during occupancy. And then we talk about using, consider installing UV air treatment systems to kill, or in this case, deactivate virus in the indoor air. And we talk about how this is a real energy efficient method to obtain those clean air changes per hour. And we talk about using portable carbon dioxide monitors to evaluate the level of freshness of the air that's in a particular space. And we go into greater detail and refer the reader to the larger document where we discuss that topic in greater detail. How much ventilation is enough? So this recommendation here was probably the one that caught the most amount of attention, I would say. And we recommend that when possible to aim for 5 or more air changes per hour of clean air to help reduce the number of germs in the air. And this can be achieved through any combination of central ventilation systems, natural ventilation, or additional devices that provide what we call equivalent air changes per hour into your existing ventilation. While there's insufficient science to identify that there's an optimum strategy for all spaces, 5 air changes per hour is what portable air cleaners provide when they're properly sized, following guidance from the Environmental Protection Agency on the selection of portable air cleaners. And this number helps to, as we'll discuss greatly, not only is it a matter of how quickly you're clearing the air, but there's enough volumetric flow that it also keeps air well mixed within that space as well. When air changes per hour, while 5 air changes per hour will not guarantee totally safe air in any space, but it does reduce the risk of exposure to germs or other harmful air contaminants. Rather than a hard and fast rule, the 5 air change per hour target provides a rough guide to the air change levels likely to be helpful. And you can see here on the graph that as you increase the number of air changes per hour, that the time it takes to purge the air reduces. But you can also see that the curve of that graph becomes flatter the higher the air changes per hour go. So there's an optimum number somewhere in there, but that optimum number is going to vary by the space and what's going on. But 5 is a good place unless you have specific reasons to aim for a different value. And we might talk about a couple of those in a moment. A large volume space, for instance, a large warehouse that only has a few people working in it, you don't need 5 air changes per hour for that kind of space. That would be a waste of energy to try to do that. And then if you have spaces that are actually higher occupancy or you have higher risk occupants, you might need greater than 5 air changes per hour. While air change per hour levels greater than 5, for instance, those that we use in healthcare environments, they might reduce infectious aerosols further or faster. The potential benefits of the increased ventilation should be balanced with the additional upfront periodic maintenance and energy costs that may be incurred. And for comparison, there was a Lancet report that was released shortly before the CDC guidance was. And in that Lancet report, that was based on the available scientific evidence of a very detailed study. And they recommended air change per hour levels as 4 as being good, and 6 as being better, and greater than 6 as being best. Now, what that really portrays is that the air change per hour rate, it's a continuum. It's not a binary A or B kind of decision. It's a continuum in terms of improving air quality. So related comments, ventilation guidance is not compatible with a one-size-fits-all approach. The CDC guidance has plenty of caveats for the individuals to look at the recommendations that are there and to pick the fit or to pick the option that better fits their application. There's also guidance coming out from other individuals. ASHRAE, which is an engineering society, recently released a standard 241, which is a standard on controlling infectious aerosols during what they call an infection risk management mode, so periods of higher infection. In contrast, the CDC guidance is really, this is the way that we're recommending that we operate our HVAC systems going forward. And so there's a little bit of contrast in there, but they also complement one another. So you could transition from one to the other as circumstances become aware. So let's do a quick example problem. And in this example problem, we're going to look at trying to achieve 5 or more air changes per hour of clean air within a classroom. And in order to calculate the clean air or the air changes per hour, you see the formula that's written there. But we need to know a few factors, such as the amount of airflow that's coming through the system and the area of the room and the height of the room. And so let's set up our example problem. In this case, the area of the room, we see the dimensions there. We have a ceiling height of 9 feet. We have our number of students and their age, plus a teacher, and that'll be important later. We'll say that it's served by a rooftop air unit and that the engineers, when they designed it, they determined that you needed 400 CFM in order to give you the right tempering for the room. Or maybe you went in and took a flow hood and you took measurements and you measured that there was a total of 400 CFM. Nevertheless, the total supplied of air to the room is 400 CFM. And we've also determined that our system meets the current ventilation code and that we've been proactive and we've upgraded the filtration up to MERV 13 as recommended. So here's a simplified graphic to show a little refresher here. You'll see outside air coming in on the left with the red, the return air coming up through the bottom, and then the supply air in the blue. We've already mentioned that the supply air was 400 CFM, so we know that value. And that's going to be a combination of the outside air that came in plus whatever got recirculated from the room. So in order to figure out, we learned it was code compliant, and the applicable code in this case is ASHRAE Standard 62.1. There are other standards for healthcare and residential facilities, but we're looking at standard 62.1. And when we look up a classroom there, we can see that for a classroom and for the age dynamic we described, we can find both the CFM per person and the CFM per air per square foot. So we can do the math and multiply that requirement times the number of people, and by the square footage, we find out our outside air requirement was 282 CFM. So since we're code compliant, that's what our outside air component. So now we just need to take the outside air and we'll turn that CFM into an ACH value. So using the equation that we talked about earlier, we have the 282 CFM of outside air times 60 CFM or 60 minutes per hour, divide that by the area and the height, and you get a total ACH just based on outside air alone of just a little bit over 3. So now we know our outside air volume and we know our total supply air volume. We can calculate that our return air must be the 118 CFM since there's 400 total. Return air is not clean, though, when it comes to infectious aerosols. The outside air was clean, but the return air is not. So we get partial credit, though, based on how well we filter that air. So in this case, we had MERV 13 filters, and those are 85% efficient against the 1 to 3 micron size range, which was shown in the previous graph. There you can see the intersection there. And so we can do the math, and the 85% times 118 CFM, so we have 100 CFM of clean air based on filtering the recirculated air. The air change per hour of that equivalent is basically 1 air changes per hour. So now our total air change per hour of clean air, we've got 3 from our outside air, and we have 1 from our recirculated filtered air. That's only 4. That's less than 5. So what are we going to do next? Well, we have some options. We need about 100 more CFM of clean air in order to meet the minimum 5 ACH per hour, 5 air changes per hour target. And to account for mixing inefficiencies in a classroom, and since classrooms are a little bit more crowded, we might even decide to go ahead a little bit above that 100 CFM and be proactive and do that. And we can do that lots of ways. We might evaluate our existing HVAC system to see if there's capacity there in the system itself to give us more ventilation in that particular space. We might decide that we're going to use a portable or a ceiling mounted HEPA air cleaner system. And a classroom's a great opportunity, for instance, to use a ceiling mounted system so you don't have extension cords and a lot of the noise is removed away from the occupants. We might, depending on the location and the seasonality, we might use window fans and at a known flow rate and use open windows and doors to help bring some outside air. Or we may decide to be more proactive on a full-time intervention and use a UVGI. And with that, I conclude my presentation, and we'll hold off on the questions until we get to the Q&A session.
Thank you, Ken. My name is Aman Patel. I lead a small biosecurity nonprofit called Technologies for Pandemic Defense. We work mostly on market shaping for biosecurity technologies like personal protective equipment. Now, my colleagues outlined the things that you should do first to protect your workplaces against pandemics, namely plan for it and implement engineering controls to keep your indoor air safe. I'm here to talk about the last line of defense, personal protective equipment, or PPE. Now, most of us remember or have firsthand experience with the news of PPE shortages from the COVID-19 pandemic in mid-2020 and onwards. The reality is that a lot of these shortages are likely to occur again. Why is that? First, like Dr. Coonan said earlier, future pandemics are likely to occur. We don't know when one will happen or where it will be, but when chances are, it will happen again. One study estimated a 50% chance of a COVID-sized pandemic within 25 years. And another one estimated that the yearly likelihood of a pandemic will triple in the coming decades due to climate change and increased animal-human interactions. We also know that current government stockpiles of PPE will not be enough to protect all essential workers in such a future pandemic. We'll do a little bit of math. At the national level, we have the Strategic National Stockpile in the US that has around 500 million disposable N95 respirators. But given that there are around 50 million essential workers in the US, even if they only use 1 disposable N95 per day, which is less than optimal, that stockpile is only going to last 10 days. And that's not nearly fast enough or long enough time to wait until PPE manufacturers can ramp up their manufacturing. And at the state level, there are still not enough stockpiles to fill that gap. California has a bit over 100 million N95s in their stockpile. And that's still not enough to change the calculus significantly. And we also know that in severe pandemics, even if we have enough PPE in the form of disposable N95s, those N95s may not even provide enough protection. Your standard disposable N95, which is called a filtering facepiece respirator, or an FFR, has a bit of leakage around the face seal that comes built in as part of the respirator package. And they tend to lose fit over time. So, while you're wearing your N95 in daily use, it's going to come a little bit loose. And the seal is not going to be maintained perfectly for your entire shift. And a lot of what I'm saying here is drawing on a big compilation study that's been done by the biosecurity consulting group Griffin Scientific, which is soon to be published. Now, the good news is we have a pretty easy solution to this problem. reusable respirators. In the non-powered form, they're called elastomeric respirators. These respirators have been shown to be safer in many ways. Fit studies show that these elastomeric respirators are more likely to fit right on the first try and are less likely to have leakage around the face seal over time in real-world use. Some recent NIOSH studies have also shown how to safely reuse and disinfect these so that, day after day, you can continue to wear these without having to swap between respirators. And the new generation of reusable elastomeric respirators hitting the market has no exhalation valve. So it provides source control to protect those around you while you're wearing it, as well as yourself. These elastomeric respirators can also be cheaper. Unlike disposable N95s, you only have to buy one to protect a staff member for the entire pandemic. Studies from 2 hospitals that implemented these elastomeric type respirators during the COVID-19 pandemic, and these were the Allegheny Health Network in Pittsburgh and the University of Maryland Medical Center in Baltimore, found that there were significant cost savings associated with this, namely because you don't have to keep on buying new respirators for every shift or every patient interaction. And you can use the same one for the entire pandemic. And it's also cheaper to store these respirators. For a 5-month pandemic stockpile, the storage requirements for an elastomeric respirator-based stockpile would only be 0.13 square miles for the entire US vital workforce, compared to over 8 square miles for N95 FFRs. And I live in Washington, DC, and 8 square miles is basically the entire size of the city, which is completely infeasible. And the icing on the cake with elastomeric respirators is that they're more worker friendly. Some models may be more comfortable than disposable N95s for long shifts, largely because of less pressure on the face, because the pressure is spread over a larger area that contacts your face rather than on just the edge of the respirator. Other studies suggest that in risky scenarios, workers may perceive that they're safer while wearing elastomeric respirators compared to wearing disposable N95s. And for workers who can't wear elastomerics for cultural or accessibility reasons, they can be outfitted with powered air purifying respirators, or PAPRs, which fit around the entire head. These are more expensive, but you likely only need them for less than 10% of your workforce. And like elastomeric respirators, they are reusable. An important point to note is that even better PPE and even better reusable respirators are possible. During a pandemic, the goal of an employer is to buy whatever PPE you can get your hands on as fast as possible. It's not to drive innovation in a product that better suits worker needs and is maximally cost effective to have for a pandemic stockpile. But now that we've kind of passed the biggest wave of COVID, we're in a time where we can reflect and start to think about how we can develop innovative products that better meet worker needs. The work my team is doing with University of Chicago's Market Shaping Accelerator is around pioneering a buyer's club for these reusable respirators to pull kind of innovative technologies into existence. Right now, manufacturers aren't interested in developing innovative products, mainly because there's nobody interested in buying those innovative products. And there's nobody interested in buying those innovative products because they don't yet exist. So we have a little bit of a catch-22 to solve. At a buyer's club, employers come together to proactively commit to purchasing innovative products, in our case, reusable respirators. And enough employees do this, they can send an advance demand signal to manufacturers who will then have a strong incentive to invest in more R&D. So essentially, this is a group of employers coming together to say, this is the product we want to exist. Manufacturers make it. And because there's enough demand with that group of employers and potential buyers together, manufacturers will have a strong reason to do so. So what can you do if you are a decision maker at your organization? The first thing and the biggest thing you can probably do is invest in building and maintaining a resilience cache of reusable respirators in your workplace. From a business perspective, more PPE for your workers sooner in the pandemic means less worker absences due to fear of illness or illness itself, And this means that there's fewer supply chain disruptions or service disruptions, and your entire operation runs more smoothly. Stocking these respirators locally is more cheap and far more reliable than relying on government stockpiles. If you have kind of a respiratory protection program in your workplace outside of pandemics, using these elastomerics instead of disposable N95s can possibly help you save money, even though it may be a bit of an upfront commitment to transition. If you don't have a respiratory protection program in your workplace already, it's possibly cheaper to stockpile these, one per essential worker in your company or organization before a pandemic than scrambling to buy disposable PPE or reusable PPE in a crunch when a pandemic starts, when everybody else is trying to buy it and when prices are inflated. And if you're a particular innovative or pioneering workplace, you can join the type of buyer's club I mentioned earlier. And please reach out if you're interested in doing so. I'll add my contact info at the end of the presentation. But more importantly than just buying the PPE and having it physically present, you need to have a plan for how you're going to use it and when you're going to use it. And you have to familiarize with your staff on how to use it. And that is kind of an important part of the equation that you can't forget. And if you're not directly a decision maker in your organization, you can talk to the people who are. You can make it clear to them that PPE is a priority and that any trauma your organization had from COVID-19 may likely to be repeated in the future. The other thing your workplace can do is encourage suppliers and peers to have the same PPE resilience caches as well. We're all more protected when everybody has PPE. From a safety perspective, if your suppliers have good PPE, this means that they're less likely to get infected with whatever the pandemic disease is. And this means that you're less likely to get infected while interacting with them. So this makes community spread a lot lower if everybody has ample PPE and uses it properly at the start of a pandemic. A good mental model to keep in your mind as you're thinking about resilience caches of PPE for future pandemics is a fire extinguisher. You know, we hope we never have a fire in the buildings we inhabit, but we're really not so naive that we don't prepare for it. We accept it as common sense that every building should have a fire extinguisher or multiple that's maintained regularly, replaced every 10 years, so that we have the tool ready if we need it and when we need it, even if we hope that the threat doesn't occur. We don't go looking to buy a fire extinguisher in large amounts after the fire starts. And this is the same fundamental attitude that we should approach pandemic PPE with. We should have it ready and hope we never have to use it. Now, to sum up, the three main points that we've addressed. In future pandemics, we're likely to have PPE shortages again. We also know that reusable respirators, like elastomeric respirators, are in many ways superior to disposable N95s, and should likely be our default conception of how to protect workers in a pandemic. And finally, employers can start doing the steps that are necessary to implement these disposable or these reusable PPE caches in their workplaces today, rather than postponing it until the pandemic starts. And what we're doing about this at Technologies for Pandemic Defense, I already mentioned that we're working with the University of Chicago to try to build these buyers club type devices and mechanisms to pull innovative technologies into existence. And I'm also working on leading a team at Cornell School of Industrial and Labor Relations to communicate labor stakeholder interests around pandemic PPE so that we can work on designing collaborative solutions between labor and employers. And so if you'd like to learn more about our work or any of the things I mentioned earlier, please feel free to get in touch. Thank you.
All right. Thank you all for your insights and for being proactive in a space that really needs proactivity, and it's typically overlooked for a lot of businesses. And Lisa, I really appreciated your point about, it's like notes on a sheet of music. It's just notes until you practice. So I think that's a really important point for our audience to take away from this. And speaking of Lisa's excellent point, you can find her ebook by clicking on either the speaker button where it's listed in her bio, or by clicking on the research button below. We've received a few questions in our Q&A about your fantastic resource. So thank you all again. And we have a couple of questions here from our audience. Starting off with, what specific advice would you give to small businesses to help them prepare for another pandemic or future crisis? So
Well,
Lisa, can you lead us off there?
Yeah, I'll start off. Well, sometimes in small business, every person, it means a lot because people wear multiple hats in a small business. And so it's really important to try to keep your staff as well and as functional as possible during a pandemic. And that means, first of all, looking at your policies for sick leave, just to ensure that if people do get sick, they don't come into work, even though there's a very strong call to do that in a small business, but they don't come to work and infect others. But the other thing is that small businesses are the backbone of our society, and they need pandemic plans and they need business continuity plans.
Yeah, it's a great point. And, I think the advice for small businesses, large businesses, I think, is be proactive. Think about this. And Aman, a great point about the fire extinguisher. I think that's a really valuable way to think about this. So Aman, actually, we had a great question from the audience about the role technology has played in helping organizations navigate challenges posed by COVID-19 and how we can leverage technologies for future challenges.
Yeah. So, technology comes in multiple forms when it comes to pandemic preparedness. The technologies, obviously, that I focused on have been around PPE. And, if you've looked in just the past 5 years, there's been a great wave of new PPE companies that have tried to solve problems with kind of the previous generation of PPE that have sprung up on the market. There's nothing like, a driver of innovation as a big crisis. And so, at the beginning of the pandemic, we saw that a lot of people took it into their own hands to try to develop new products that were really made for use in pandemics like COVID-19. The problem is now a lot of those innovative companies are finding it hard to find a market for their technologies because with pandemic technologies, they're usable in a pandemic, but once you're kind of out of that first wave of a pandemic and you're kind of returning to normal life again, a lot of those technologies don't really have any value anymore, at least value that's kind of apparent from an infectious disease control perspective. And this is true of kind of the indoor air quality technologies that Ken mentioned. Obviously, in a pandemic, priority number one is to make sure an infectious disease does not spread and that you have adequate ventilation to keep your indoor air safe. But the kind of immediacy of the need for that technology becomes less apparent once you're not in a pandemic anymore. And so I think kind of the big call to action that I propose is to not let the value of these new technologies kind of fade from our memory. And that we keep on thinking about the technologies that we need and that we'd want to have in a future pandemic right now.
That's a great point. The time to prepare is not the time when you're in the next pandemic. So that's a great takeaway. And speaking of what Aman just said, we have a question from the audience for you, Ken, about how have workplace ventilation and filtration measures been influenced by local and international health regulations? And what steps could employers take to ensure ongoing compliance with these evolving standards?
Well, so in terms of in the ventilation world, the local regulations have really kind of not really been verbal on control infectious aerosols. And so that's kind of was the awakening that I believe that came from COVID was and the COVID-19 experience. And that's part of the reason why the recent guidance updates as well caught the attention that it did, was because for the first time that topic of control of infectious aerosols outside of a healthcare environment was becoming a topic du jour, for instance, for indoor air quality purposes. So I think the regulatory guidance really has some catching up to do, and ASHRAE has shown that they're being responsive in doing that with their most recent standard update, and I think we'll see others continue to do so as well.
Yeah, that's a really good point. And one of our audience members asked a question about resources and incentives available to help organizations that are a little bit more budget conscious offset some of the costs for investing in these suggestions and getting ahead of a cache of equipment. Are any of you aware of some of these options for budget stressed or smaller companies?
I'm not aware for private market. I think private industry is, I'm not aware of things being available to them, but certainly for schools, libraries, social organizations, I think there have been some opportunities through the recent budget incentives that have been available to them, and to some extent are still available.
Well, I think as Aman just pointed out, this is a good proactive investment in getting ahead of things. And I think that's how you look at it, just same way that you would retool a factory or think about the many benefits of workplace filtration. So question for you, Aman, about the filters on reusable masks, how long they last, if you have to be fit tested for them, if there are third parties that do this fit testing, and is there a shelf life for the respirators as this technology continues to evolve?
Yeah, great question. So usually the face piece itself on an elastomeric respirator lasts around 10 years on the shelf. And the filters that you can change out usually last 5 years on the shelf. So, these are kind of long shelf lives, so you don't have to think about replacing these too often. But every 5 years, you're going to have to do a check on your filters and replace any of the ones that have expired in that 5-year period. And then every 10 years, you're going to have to replace the face piece itself that touches your face. And so that's kind of the timelines that we're dealing with when dealing with these elastomeric respirators. And the nice thing about these timelines is that it's roughly the same as a lot of these fire protection products that I mentioned earlier. A fire extinguisher also operates on these 10-year timelines. And it costs around the same to replace as an elastomeric respirator. And so kind of the filters on an elastomeric respirator, often you can have a new replacement for them, cost $10, and the face piece itself, again, between $20 and $40. So really only talking about a couple dollars each year that you need to spend on maintaining this stock.
Yeah, I mean, that seems like a pretty reasonable investment, and a decade is certainly a long period of time. So it seems like a reasonable investment to keep your employees safe. Lisa, you mentioned being able to communicate with employees at all times. Do you have recommendations for tools or approaches to do this effectively?
Well, there's a number of companies, and that is their central focus, is to work with a business, put all their company employees in a database with all their contact information. And so then when the company wants to communicate, it's an easy measure just to create a message and click a couple of buttons. So these kind of things can be constructed ahead of time. It oftentimes in where companies are located, where there's weather issues in the winter, they may close their offices because of snow or ice, or places that have hurricanes or tornadoes. So these kind of services can be used for all kinds of emergencies, as well as for a future infectious disease threat.
Well, I think a key point that we've discussed at Health Action Alliance too is making sure that you're thinking about your entire employee population.
Right.
So making sure, that's important too from a diversity and inclusion perspective.
Absolutely, as well as sometimes the people include their vendors and their key contractors because they're critical to the operation as well.
That's a really good point, and something we've been discussing too as climate change and extreme weather events become more common. this is something that we're starting to see more businesses starting to think about. How do they create climate resilient workforces? Which actually, Ken, brings up a great question from our audience about, does CDC NIOSH make recommendations for filtering and cycling for remote-based worker environments like home HVAC systems? And the reason I connect that to climate change is we saw just this summer about wildfire smoke and all these kind of things, obviously important for office buildings, but just as important to think about your employees' health and safety more broadly.
Well, certainly the CDC website does have guidance on residential as well as like small daycare facilities and things like that fall outside of the traditional business kind of environment. A lot of it's very similar to what you'll see on the business side, but there's the reality of the smaller scale, some realities as well that if you're living with a particular person residentially, that you may do things like look to do isolated restroom facilities if that's an option, and some other nuances, as well as when you have visitors over to your home residentially. So there are even some interactive tools where you can select, what if I put a portable air cleaner in my room? What's that going to do to removing the infectious aerosols in the space? And so I'd encourage people to go to the CDC website and to search for those items under the COVID guidance, and then just look up residential.
Fantastic. Yeah, I know from speaking from personal experience, when we installed an ERV system in our home, it made a big difference on just the air that we breathe, which obviously has big impacts on your health and productivity more broadly. So I think it's great that more people are focused on filtration and clean air. And I know Dr. Allen at Harvard has done some really interesting research on the impacts that this can have for overall employee health, and the investment that businesses can make in this. Aman, we had a couple follow-up questions for you. You talked about shelf life, but one of our audience members had a question about once in use, when you replace the cartridge.
Yeah. So first, let me answer the first part of the second part of the question that you asked previously that I realized I forgot to answer, which was around fit testing. So elastomeric respirators still do have to be fit tested, and there are third-party services that do offer this service. So that is something important to keep in mind. And on this question, once in use, how often do you kind of replace the filters? This is going to differ per manufacturer. So kind of the source of truth for what you should be doing depends on the model of elastomeric respirators that you have. And so I'd refer kind of to the products that you're interested in, the manuals that accompany those products as the final source of truth, rather than what I can tell you.
Great. Well, and Aman, while we have you up, are there lessons to be learned from managing the PPE logistics that can be applied to future scenarios involving emerging diseases?
Yeah. So one of the hospitals I mentioned earlier that implemented elastomeric respirators in their workplace, in 2020 and 2021, and this was the University of Maryland Medical Center. Two professors there, Dr. Stella Hines and Dr. Paul Thurman, wrote up a long implementation guide on how to implement elastomeric respirators in hospitals. And this is kind of a mix of lessons learned that they had from the pandemic and how it can be applied to other workplaces going forward. And so that's an excellent resource that I'd highly recommend you check out. And I'd say that would have a lot of information on the finer points of logistics that might not be obvious when you're just trying to plan it out from first principles.
Great. Well, thank you for clarifying that. Lisa, kind of a broad question, but somebody in our audience was asking, well, what else should businesses be doing right now? So could you maybe provide some more practical guidance for what our audience members can do as soon as they leave this call in a few hours?
Great question. Well, the pandemic has changed the way that employers think and the way that employees think. There's been a recognition that infectious diseases can happen and they can strike without warning, and they can be very disruptive. So one of my suggestions is most businesses that have a business continuity plan do a business interruption analysis every year, BIA. And in doing that, they look for things that would create a disruption in continuity. So they're looking at computer systems, they're looking at the physical plant. And I'm suggesting that you add pandemic threats as part of the BIA process, because thinking about remote working or thinking about some of the protective strategies that we discussed, those are things that need planning and they need preparation. And so including that in the BIA would be really important. The other thing I would say is that our world has changed. We really have seen redoubling of the importance of a safer workplace and the fact that employees count on their employers to keep them safe at work. And this was really borne true through the pandemic. So continuing to provide policies that are protective, recognizing the work-life balance that's really become very important for the workforce, and the good communications that are needed with staff. Those are things that we realized during the pandemic and they need to carry on.
That's a great clarification. And I know Aman had given some interesting stats about the likelihood that we'll have to prepare for these. So somebody in our audience was asking if you can provide some examples of anticipated pandemics, future crises that you would expect businesses should be prepared for. So a nice uplifting conversation question for you all.
Yeah, well, that's kind of a bit daunting to think about. And it is hard to say, as Lisa said in the beginning of her presentation, what the exact threat that we're going to face next will be. I think it would be wise to prepare for another respiratory pandemic, just because these are the things that can often spread the fastest. And as we saw with COVID, can cause a lot of damage. And so I think, as at least a mainline scenario, businesses should be preparing for another respiratory pandemic of the scale of COVID or worse, as kind of, as Lisa said, kind of a part of their regular threat hazard analysis or business continuity planning. And Lisa, actually, I'd be curious to hear if you have any other suggestions for specific scenarios.
Yes, I agree with you. I think that is probably the major focus for most pandemic planning. We've been tracking the avian flu or the bird flu viruses for years with trepidation that they may jump to become a human pandemic, and they haven't gone away. So they're still circulating around the world. And so respiratory threats, I think, continue to be at the top of the list for the World Health Organization and for public health here in the U.S.
Well, I think the fact that you can't predict is exactly why you should be thoughtful about getting as far ahead as possible. And so actually, this is a good question from the audience for you, Lisa. Have you seen companies' crisis management resilience plans evolve? And how do you see that continuing to change in the future?
Great question. What I've seen is, and in the businesses I've been working with, they're expanding their business continuity plans to not only include fire, flood, weather, and the more traditional threats, but also another pandemic or another influenza threat, maybe a very, very bad flu season, because those things require such different responses than some of the other threats. So people are updating their business continuity plans, doing exercises and drills, thinking about exactly what Ken's talking about in terms of maintaining a great ventilation in their building facilities, thinking about what Aman was talking about and what should they stockpile, keeping their signs up about good hand washing, because that would be helpful during flu season. So I've seen a lot of progress, and I'm hoping that folks that are listening in today will take some of these ideas and work on them in their own businesses.
Yeah, I think that we've a lot of good discussion here. Ken, we had a quick question for you about HVAC systems in places where you don't always get fresh air. So thinking about subways and things like that. So if you could provide a little bit more thought about those options.
Well, of course, one of the things that came out of the pandemic was people are having to rethink about how those kind of areas are ventilated. And I think you're going to continue to see that. I've seen studies, for instance, where either an end duct or upper room ultraviolet germicidal system was about being evaluated. Certainly portable air cleaning or even permanent air cleaning systems that are going to remove the infectious aerosols. You can't replace the cleanliness of outside air when it comes to infectious aerosols. It's hard to compete with. But you can compete if you're using UV or if you're using air cleaning with a filter. And the one dual advantage of using air cleaning with a filter is you're also taking other aerosols that one might be exposed to, whether it's wildfire smoke or engine exhaust, if that's what your vehicle is having to deal with. So there's auxiliary advantages to a proactive air cleaning approach.
Yeah, I think clean air is just so valuable for worker productivity and safety, and there's just so many limitless benefits that I think is really important for a lot of businesses to think about how they can be investing in clean indoor air. So that's about all the time we have for this fascinating discussion. I think a great key takeaway is to really be thinking ahead, and I think you've all provided some really interesting insights for our audience to think about. So thank you all so much. Appreciate the answers and the work that all of you are doing. So thank you for being here. So now we're going to be moving on to our final speaker of the day, who's going to touch on the future of working from home and hybrid remote work, which is a topic that a lot of you have been asking about in the chat or in the Q&A feature. So we're thrilled to have Nick Bloom. He's a professor of economics at Stanford University, and he's been researching remote work for almost 20 years, way before the pandemic. And so we will hear his insights on the future of working from home and its benefits, as well as some of its challenges. So Nick, take it away.
Mark, thanks very much for having me on. Yes, exactly. I'm going to talk about, does work from home have a future? So next slide, thanks. Yep. So I've been working on working from home for almost 20 years. It's odd that it was not a very exciting topic until March 2020. And then the whole world got very focused on this. You can imagine in March 2020, there was suddenly an explosion of interest. And since that time, I've been doing a couple of things, which I'm going to draw on today. So firstly, talking to hundreds and hundreds, by this point, thousands of managers, executives, individuals, employees across companies right across the US and globally. And then secondly, collecting very detailed survey data. And so I'm going to bring those together in order to discuss what we're going to go through today. So the three things I want to focus on is, one is, what is the current state of working from home? Then I'll talk about the impacts on managing hybrid and remote. And then finally, 3 impacts on the economy. So first figure here, this really gives you a roadmap of where we are in terms of work from home in the US. So this is the share of full paid days that people are working from home. Why full paid days? The reason is we care about commute, and obviously you care about office use. What you can see is before the pandemic, that was about 5%. So basically people did work from home a bit before the pandemic, but not much. During the early stages of the pandemic, it jumps to 60%. Pretty much everyone that could work from home, however badly, was doing that full time in the early pandemic. So there's probably many people listening that were fully remote. And then it slowly drops back down. Critical thing to note here is look at the beginning of 2023. So from the beginning of 2023 onwards, this series has become completely flat. There are 2 different series here I'm showing you. One is Sway. It's our own data. We survey 10,000 Americans a month. And the second is the US Census data, where they survey 40,000 Americans a month. So these are very, very accurate data series. And you can see something kind of amazing happened at the end of 22, beginning of 23. This thing went flat. As a Brit, we would say flat as a pancake. and it's stabilized. So this tells you basically we are in the new normal now. If you hear anyone say when we go back to the office, that is just not happening anymore. We have stabilized where we are now is where we're going to be next year and probably 2 years from now. And in fact, another way to look at it is looking at office occupancy data. So this is data from Castle Security, and what they're looking at is swipe card data. So they have hundreds of offices across the US, and they're looking at swipes, how many people are swiping into an office every day. Here it's normalized to 100% pre-pandemic. What you can see is early in the pandemic, basically no one was in the office. Offices were totally empty. Slowly rises until the end of 2022. At this point, for the last year, it's now been flat. So again, offices tell almost the same story. Early pandemic, everyone was at home. The last year, it's stable. This is the new normal. We are now in the new normal, and we've been here actually for about a year. So if instead we now look at, next slide, thanks. So instead we look globally. So this is data across countries. And what we see is working from home turns out to be very high in North America and Canada. If you're, part of multinationals, US, Canada, actually UK, where I'm from, I'm a dual national, but I was born and grew up in the UK, Australia. Basically, English-speaking countries are pretty high. You're looking at around 2 days a week, typically. Grads will work from home. Europe's a little lower. It's about 1 day a week. I've been in Europe a lot this year, Stockholm, Oslo, London, Venice, etc. So that's, Europeans are still into work from home, just not the same level. South and Central America is a little lower. Asia's lower still. So for anyone that's part of a big multinational, don't be surprised if you find Asian offices say we're going back. They mostly are, but not completely. But North America, Northern Europe seem to be very much, stuck with work from home. So then if we look at the workforce, there are actually 3 different types of people. I'm sure everyone listening is aware of this. This comes up all the time. The number of firms and execs I've spoken to have said most people can't work from home, and those that can't are really upset. This is going to just highlight that in data. So if you look across the US, the largest group of employees, at 60% of people cannot work from home at all. So if I think of Stanford, my own employer has almost 20,000 employees. About 10,000 of these, a bit less, frontline employees. Think of food service, security, cleaning, accommodation. These are people that have to come in every day, and they are coming in every day. They tend to be lower paid. That tends to be most of the frontline staff. There's then a middle group. So it's about 30%. It's probably many people listening, managers, professionals. If I think of my undergrads, exec ed, MBAs out of Stanford, they pretty much all fit in this middle group here. These are professionals, managers. They're mostly grads. They're typically hybrid. So a very standard pattern here will be, it's kind of like the vanilla ice cream of work from home. It'll be Monday, Friday, working from home. Tuesday, Wednesday, Thursday, come in the office. And I'll come on to this later. Happy to discuss in Q&A. Like ice cream, there are hundreds of flavors. I was in the store the other day, and there was artichoke ice cream, which I have to say sounded pretty disgusting. But, like work from home, there's many, many different varieties. But if there's vanilla, it would be Monday, Friday at home, Tuesday, Wednesday, Thursday in the office. And then finally, there's the bottom 10% in red. These are full work from home. So these are guys that are kind of coming in, working from home Monday, Tuesday, Wednesday, Thursday, Friday, rinse and repeat, Monday, Tuesday, Wednesday, Thursday, Friday. That's about 10%. It's mostly specialized roles at this point. So it's mostly like IT support, payroll, HR, benefits. There are some top-end coders, think Airbnb, but mostly these are kind of, specialized back office roles. So in Stanford, we have a couple of thousand of these folks, and they're spread across the country. Some may even be internationally, but, that is the smallest group. Then, in some ways, the figure on the left here, I'm going to try and argue, again, this thing is permanent. If anyone's skeptical at this point, hopefully, you believe me. The figure on the left is the most amazing figure. I was actually about to put it out on LinkedIn this week, which is the share of retail spending that's online. So, let's start at the beginning. This thing is rising over time very steadily. That is no surprise. Amazon's growing, Instacart is growing, eBay's growing, blah, blah, blah. Okay, fine. People are spending more money online. It also then jumps in the pandemic. Again, no surprise. Lockdown, we were using Safeway and Instacart in our house. You have to buy stuff online. It was hard to get out of the house. But the amazing thing is it returns to trend. So if you look, by 2023, it's totally back on trend. If you're an alien and had been, in space for the last 3 years and landed, and you'd missed the pandemic, you'd think nothing had happened. We're completely on trend. And we see similar things if you look at eating out, if you look at attendance at NFL games, concerts, Taylor Swift, they're like selling out. Anything that is, in most of the economy is basically a return to pre-pandemic levels. The one area where we see permanent shifts are things related to work from home on the right and stuff that's either upstream or downstream. And I come on to that at the end. I'll talk about golf. If you play golf, you've been affected by work from home. If use the gym, etc. I'll come back to explain this later. But this shows you most of the economy is back to its pre-pandemic level and trend. The big exception is things that are upstream or downstream of work from home. And that looks like it's a permanent shift. And roughly there's about 5 times as many days at home now as there were in 2019. So it also varies a lot across industries. I raise this because, I talk to people from so many different industries and their experiences are really different. So at the top, this is information. This is tech, basically, just below finance. So these are industries with tons of work from home people. Why? Because most of the employees are graduates working on computers every day. And it's very easy to have a graduate working on computer, being at home 2, 3, 4 days a week. At the other end, right down at the bottom, we have hospitality and food service. In fact, I was in Las Vegas about 3 weeks ago to talk to about 1,000 people from the food service industry. And they're saying, look, everyone on the front line coming into, stores is in person. The managers are in person. The regional managers are mostly in person. These are industries, hospitality, warehouse, retail, that's very much in person. And it kind of makes sense. Look, if I worked a bit in retail many years ago, and frontline has to be in person, it pushes up the whole organization. So there are enormous differences across industry. And if you read in the media that Zoom is doing this or Facebook's doing that, that's great. But it's not that relevant often to, if you're working in McDonald's, KFC, or warehousing, for example. So another area where I get asked a lot about, where surprisingly there isn't much of a difference, is by gender. So this is US data. In the US, there's really very little differences in terms of work from home levels by gender. Women have a slightly higher level, but it's not that big. It's a couple of % higher. The samples here, we're looking at, 100, 200,000 people filling in our survey. So it's statistically significant, but the gap is tiny. Interesting enough, I've looked at a lot of data from other countries. If you go to countries, related to the theme of safety in particular, if you go to places like India, I've seen data where commuting is not nearly as safe, particularly if you're female. There's harassment risk in the office. You see big gender differences, but in North America, it turns out to be relatively stable by gender, relatively similar. Where we do see really large differences is by education and really by income. So this shows you that graduates, basically high earners, have much higher, in this case, about twice the level of work from home of non-grads. So there is an issue that comes up a lot when I'm talking to execs about a bit of a them and us thing. High paid execs, managers are getting this fantastic work from home perk. Frontline staff typically aren't, and it does generate some issues. And I'm happy to discuss this, but it's worth, point one, acknowledging this and say there is a real divide in the workplace. Another area where we see variations, kind of interesting, is by age. So this shows you by 5-year buckets, and what you can see is folks in their 20s are pretty keen. Their levels of work from home are relatively low. They're actually relatively quite keen on coming in the office. So, my kids, I'm 50, my oldest kids are in this bucket. Most of my students in Stanford sit here. I talk to tons of them. What you hear all the time is they say, I'd like to work from home maybe 1 day a week, maybe 2 days a week. I kind of want to come in. Most days I want to get mentored. It's much easier to mentor and train in person. It's more social. It's livelier in the office. It's kind of, isolating, can be lonely at home. And finally, they'll say, there's like 5 of us sharing an apartment. I mean, where am I going to work? Like, I have my bedroom. There's one living room. We can't, I don't want to spend all day and all night in my bedroom. And, we can't all work from home in the living room. And even if my house, apartment friends go away, I can't start until the last person leaves. And then, somebody comes back early and they're like, I'm back. And I'm like, my day's over. So turns out people in their 20s are quite keen on coming in. People in their 30s and 40s, if you look at that, you see much higher preferences and levels to work from home. It's basically driven by young kids. So folks that have, 1, 2, 3, maybe kids at home, particularly young kids under the age of 12, they're pretty keen to work from home at least, more days. And then when you get up to 50 plus, we see there's more empty nesters. There's more people that have had a 30, 40-year career of being in person and feel more comfortable with it. So I put this up to show there is this life cycle profile, and it actually affects strategy of firms. So if you're Airbnb and you tell everyone we're going to be fully remote, you're going to struggle to hire 20-somethings. If you're, say, Apple, and you're much more focused on coming in the office, you're going to do well with 20-somethings, but you're going to struggle to hire late 30s, early 40s with young kids. So the work from home pattern also affects many other things, including firm strategy. So why has it ended up this way? Why is hybrid, I kind of cut to the chase. Hybrid has become so dominant, so popular for managers and professionals. Most graduates are now in hybrid, most managers and professionals. Why is that? Well, there are 4 factors worth highlighting. The big ones are really 1 and 2. So one is, hybrids become critical, and I'll show you some data in a minute. It's been critical, though, for recruitment and retention, but a lot of execs worry about productivity. So I'll go through these 2, and then I'll very briefly talk about rent and talent. So on happiness, probably the single best data point is this. We have surveyed tens of thousands of Americans, actually tens of thousands of people across countries. You get a very robust answer to how much do you value hybrid, the ability to work from home 2 to 3 days a week in terms of your current pay. The answer is between about 5 to 10% with an average of about 8%. So the typical person says, I value the ability to work from home 2, 3 days a week about as much as an 8% pay increase. You're kind of like, I don't know, some people see that as big, some people see that as small. To position it, there's a famous paper by Danny Kahneman, who won the Nobel Prize in economics. He had a paper in Science in 2002, and he looked at what people like and dislike throughout the day, hour by hour. And he said, the thing people hate the second most is work. People don't like working. This is why you have to pay them to do it. He said the things that people hate the most is actually commuting. So people actually hate commuting even more than they hate work on average. So you can imagine if you're hybrid 3 days a week, you avoid on average something like 3-4 hours a week of commuting. That's a lot. You can live further away. You can have more space. There's just a lot of benefits. And this is how this turns out to be a big deal. In fact, one recruiter I was talking to recently, she said, look, pre-pandemic, it used to be when you're recruiting people that have the big 2 perks, pension and healthcare. She said, now the big 3 are pension and healthcare and your work from home policy. Said, if you don't have an attractive work from home policy, you're looking at having to pay people 5% more. If you want folks in the office 5 days a week and other offers offering them hybrid, you're maybe going to have to pay them 10% more. So this is a big driver of why hybrid's so popular. It's really valuable to employees for recruitment and retention. Another way to put numbers on it, I have what's called a randomized control trial. And what we did, as I explained, is in a company, there's a company called Trip.com. They're one of the world's 3 big travel agents. There's Expedia, there's Booking, and there's Trip. Trip have about 40,000 employees. They're NASDAQ listed. I think they're worth, $40-50 billion. I know their chairman, James Liang, and their CEO, Jane Sun. And with them, we ran a randomized control trial. So what it is, we took 2 divisions. And in those divisions, they're basically all grads, engineers, marketing, finance professionals. A third of them are actually postgrads. These are pretty high-end employees. If you have an even birthday, so you're born on the 2nd, 4th, 6th, 8th, 10th of the month, you had to stay in the office and keep coming in 5 days a week. If you have an odd birthday, so you're born on the 1st, 3rd, 5th, 7th, 9th of the month, you got to work from home on Wednesday, Friday. We ran this experiment for 6 months. What did we find? Well, first thing is on performance, we found absolutely nothing. So there's actually no difference in performance. We looked at lines of code written, promotions, performance reviews. We actually had the text of their performance reviews. We analyzed it. There was just no difference. So hybrid is not better, but it was also not worse. It was kind of flat. The other thing we looked at was employee satisfaction, feedback scores, and in particular, you can see on the right, quit rates. And we found that employees who are allowed to work from home 2 days a week were much happier, and they voted with their feet. Their quit rates fell by a third. And the board of Trip.com said, they kind of said, what's not to like? But there's no impact on performance. We may even save a bit of space if we're clever about this. And we're reducing quit rates by a third. And every person that quits costs the business about $20,000 to $30,000. It's really expensive having a quit. You've got to go hire somebody, train them, pay, sign-on bonuses, etc. So they're like, this is an easy decision. They just rolled this out to the whole company. So these are examples of why hybrid has become so dominant. It saves you a lot of money on recruitment and retention, tens of thousands of dollars, per employee that quits. So the sting in the tail, the thing I got asked a lot about is, well, good, okay, so employees like hybrid, but there's a downside. And the downside is it damages productivity. And what about that? So here I go through the research evidence, and to explain this, I want to be really clear about there's two very different things that tend to get confused together. So on the left, there's fully remote. So fully remote is you're working from home Monday, Tuesday, Wednesday, Thursday, Friday, next week, Monday, Tuesday, etc. You're just not coming in the office. You're basically fully remote. Maybe you have off-sites once every 6 to 8 weeks, but pretty much you're at home every day. The evidence on that's a bit mixed. It's very sensitive to how well managed it is. So at the beginning of the pandemic, when people were thrown home at speed with no warning, it looks terrible. Productivity effects are like minus 30%. In much better setups, well-organized organizations, think kind of GitHub or someone that's been doing this for years, they can get kind of flat. The average of all of this maybe is, I don't know, I mean, it's a range, but maybe minus 10%. It's harder to mentor, it's harder to train, to innovate, to build culture. You may then say, look, why does anyone do fully remote? It's, if it's like minus 10%, say, in productivity, it makes no sense. The reason for this is firms care about profitability, ultimately, not productivity. And sure, imagine it's minus 10% on productivity. Offsetting that, you don't have to pay for an office. Office costs save you about 10% straight off. And you can hire people nationally or internationally. So, for example, for Stanford, if we hire people on the Southeast, it's lower wage rates. If you are hard people, I work with some firms that hire coders, say down in South America, or people doing accounting, and they say, look, that's 50% the wage rate. So fully remote is really a thing about, sure, productivity is maybe 10% less, but costs are, say, 30, 40% less. So it's actually a pretty good deal, and it can be really profitable. Hybrid, on the other hand, what I call organized hybrid, let's say work from home Monday, Friday, in the office Tuesday, Wednesday, Thursday, that looks like it's about flat on productivity. You may say, look, there's some downsides, which there are. There's less face time, you're less in the office. There's it's slightly harder maybe to mentor and innovate. On the other hand, they save a lot of commute time, which means they can work a bit more. They're more refreshed, they're less tired, and it's quieter at home. And there's lots of evidence that quiet helps performance. So hybrid's kind of flat. So that's, recruitment and productivity. What about space? Space turns out to be the big disappointment. So I've talked to a lot of boards, and you have this, regular dispute whereby the head of real estate will be like, I'm only managing to save 10 to 20% of space. It's just really hard. And the CEO will be saying, well, look, footfall in the office is down 50%. How come space is only down 10%? That's a failure. The simple answer is, with hybrid, if you're coming in 3 days, it's really hard to cut space. So if you're all coming in Tuesday, Wednesday, Thursday, you really can't reduce space. Of course, you can stagger it. You can say team A, Monday, Tuesday, Wednesday, team B, Tuesday, Wednesday, Thursday, team B, C. But there's some real problems with that. You've got to have clean desks. Teams don't overlap. And then you're like, what's the point of having a company if no one overlaps? Somebody's got to have Friday. That really doesn't make people happy. You're like, if you're team C and you've got Friday, you're like really upset about it. One company I dealt with said, well, we fixed that. We rotate. So every 6 months it changed. And then they said, but we discovered it was a disaster because people set up like kindergarten and childcare and schedules. Then it was like, so it turns out hybrid is probably easier if you just have the same days. It doesn't save that much space, but so that's why space has been a bit of a disappointment. If you look overall, my overall assessment is for professionals and managers, fully in person doesn't really make sense. It doesn't seem to improve productivity, doesn't save you space. It makes it harder to hire people. And particularly getting people in on Friday, quite honestly, pisses people off. It's like, why would you, annoy your employees without any obvious upside? So 5 days in person, 4 people that can work from home. So 4 professionals and managers that can do their job remotely is actually very rare. Companies that are trying to do it often fail. There are a few, you can imagine, big name CEOs that are like, all my employees are back in. when you actually collect data or look at the companies, they are really struggling. They are, because the managers don't agree. The middle managers say, what's the point? Why are we beating up our employees to get them in on Friday? So fully in person for professionals and managers that can work from home is kind of gone. The choices really are between organized hybrid, say, coordinating over, 3 days a week, say, or fully remote. Most people go to organized hybrid because of productivity, innovation, recruitment benefits. But many big organizations have a mix of all of them. So Stanford has like 10,000 people coming every day. We have about 8,000, I think, that are hybrid and about 2,000 that are remote. And it really depends on the role. So how would I manage this? This is a complicated process. In many ways, this is the most important figure on managing hybrid. So the big debate that comes up over and over again when I talk to people is this kind of battle between choice versus coordination. So I've even changed my mind. So I'll be open to say, I thought one thing, and over talking to honestly hundreds of managers and execs, I changed my mind. So my thought process at the beginning of the pandemic was, look, you should let employees choose which days they come into their hybrid. Everybody likes choice. I want to coordinate with my wife or my kids, whatever. So choice seems to be sensible. Problem is, if you look at this data, you can see the reason people want to come into the office is they want to coordinate and socialize with co-workers. And the downside of choice you hear over and over again is people will say, I came in, I spent the day on Zoom, like half the team, like no one was there. The office was low energy. I was really annoyed. Like, why did I have to come in to spend all day on Zoom? I could have done that at home. And so increasingly companies are going to coordination and saying, look, the big reason we come in is to spend time with each other. It's not the manager, it's not the bagels, it's not the ping pong table or whatever it is. It's basically to spend time with coworkers. So as a result, coordination is now dominating. If you look in the data, what we see is most firms are coordinating either at the team level, this is these red bars, particularly in larger companies, or they're coordinating at the company level. Like Disney, for example, says everybody comes in Monday, Tuesday, Wednesday, Thursday. You work from home on Friday. Google, for example, says each team has to pick 3 days. Either way, coordination is really dominant. It's not clear to me it matters how much you let teams choose versus you choose for them. This shows you which days people are actually coming in. Turns out Friday is kind of dead. I mean, Steve Roth, who is the chairman of Vornado, a huge real estate company, just said, I've given up on Friday. It's like the new weekend. Like no one's coming in on Friday. So then you're looking at 4 days. Most people don't want to come in on Monday. So it turns out it's maybe one of those false choice things. If you're having 3 days a week, most people end up Tuesday, Wednesday, Thursday. So, another thing to think about in terms of hybrid managing, I'll go through a couple of tips and then kind of wrap up for the impact. So two things to think about for managing hybrid. One is make the office nice. So on the left is kind of old school photos of things that used to be popular before the pandemic. So in fact, the photo at the top, I didn't want to embarrass any company, comes from Mad Men, the TV show, but it's those kind of corridor offices that no one really is using that much. That's what I call library function. So if you think of students at university campuses, they use the library a lot, but they're never taking out books. They're going to the library as a quiet place to work. And we used to use quiet places to work in the office pre-pandemic. Nowadays, if we want quiet, we generally just think we're going to do it at home. So things like long office corridors, loads of cubicles. When I visit companies, this stuff is so typically low density, hardly used. On the right is what I see is really packed. People are complaining there's not enough space. Video cubes for Zoom calls, small meeting rooms, big meeting rooms. So the reason is if you're in Tuesday, Wednesday, Thursday, 3 days a week, those are like meeting focused, presentations, training, lunches. People are together. That's why they come in, which means you want more social space, more working together space. So that's been a big shift, moving from individual space to joint space. The other big thing that's become really important is performance reviews. So I've talked to so many managers, and the story you hear over and over again is something like this. So they'll say, look, when people are in the office, you can kind of see how hard they're working. You can see, are they at their computer typing away? When you walk past it, does the screen show, Word or Excel or maybe email, or does it instead, do they look like they're, watching Netflix or doing online competitions or watching the Champions League or something? So they say, look, you can kind of tell if people are working hard in the office. It's management by walking around. It's like a 5 out of 10. It's not particularly great management, but it's livable. You can get by on that. And then say, look, when somebody's working at home, you've just no idea what they're doing. You can't tell. Surveillance stuff where you monitor keystrokes or use the camera is spooky and unpleasant. And so what can you basically, you can't do what I'll call input management. You can't evaluate inputs, hours, and how hard they're working when they're at home. There's just no way to see it. And so there's been a big movement away from that towards output evaluation. So if Mark's my boss, he'll say, Nick, here's your 4 objectives for the day or the week. And I'm just going to assess you on that. I may collect data on what you've done, talk to customers, clients, co-workers, looks at lines of code, looks at deliverables, sales, various outputs, and evaluate based on that. And the benefits are for my manager, say that's Mark, he can assess me without breathing down my neck and checking in on me all the time and knows that I should be incentivized when I'm at home. I, in return, actually prefer this too, because I can think, look, if I want to go pick my kids up from school early and work a bit in the evening, I can do that. He's not like, evaluating, am I responding to email really quickly? He's evaluating what I do. And so performance management has become much more important, and it generally turns out to be positive for both managers and management. So overall, what are the key tips? I would coordinate on the same days, 2, 3, maybe 4 days a week. There's no kind of cookbook on this, but certainly given the number of days, let's coordinate on it. I promote in-person events when people come in, meetings, trainings, lunches, make there a reason to come in. So people feel like it's lively, they've connected, they feel happy that they've come in. Suggest quiet stuff, cross-office meetings, reading, writing, data stuff on home days. Point 4, I would get tougher on anchor days. So on the in-office days, there's a big problem if you got a team of 8 and one person says, look, I want to stay home because it's cold, or, I want to watch the World Cup or something. It's like, well, yes, that might work for you to get your stuff done, but you spill over onto everyone else. The rest of the team that wants to meet you, they now have to get onto Zoom, and it's annoying. There's a team meeting, we have to go into a conference room. So I would treat in-person attendance like you would in 2019. If somebody has a sick child, or the water pipe bursts, or they're ill, or their car's stolen, sure. But, it should be kind of similar to what it was before in terms of making sure people come in. I mentioned performance evaluation tools, and to end, the place where it's really sensitive to time in the office is new hires. So a few organizations are saying, look, we're going to get newbies in, folks that have been, maybe less than a year in for an extra day a week to meet different managers. Finally, one other thing, given the National Safety Council's focus, is another benefit of work from home is reduction of infections and sickness. So we posed this question in the survey early in the year. So we surveyed 10,000 people a month. We did this 2 months in a row. We said, were you sick or injured in the last month? And about 600 people said, yes, they were. And then we said, what did you do? And did you go to work anyway? Did you work from home, or did you not work? And we've broken it down by whether you're able to work from home. Yes, that's the lower bar, or not able to, no, which is the upper bar. Well, you can see if people can't work from home, about 3/4 of them just come to work anyway if they're sick or injured, which is obviously not a great thing. If they can work from home, you notice that number halves, and the largest group actually say, we're going to keep working, but we're going to do it from home. And there's clearly a group in both cases that don't work at all. What this highlights is having a regular hybrid setup whereby people are regularly working from home means it's much easier. If I'm supposed to be in on a Tuesday, but I'm sick, it's less of a big deal if I say, look, I'm not feeling great, I'm just going to work from home on Tuesday. It's a normal thing. I've done it on Monday, I did it on Friday. If instead there's nothing allowed, I feel like I'm a skiver, and I feel, well, I better come in, and then I come in and just infect everyone else in the office. So actually having regularized work from home is an important way to stop infection spreading around offices, because it's much easier and seems much more normalized for people to work from home. So finally, what about some impacts on the economy? I'll go through 3. So one is the donut effect. So we've got incredible data to show that about 1 million people have left the center of big US cities. So the United States Postal Service has this amazing database. It has all of us in it. We're all in it. Our addresses are in this database. And if I move from here to, I don't know, Berkeley, the United States Postal Service is very good at tracking me, because it likes to sell those address samples to marketers to make money. So what we've got from them is the flow of people by zip code by month. And what we've seen is about 1 million Americans have left the center of big cities and moved out to the suburbs. So you can see what's going on. I used to be in the center. I went into work every day, and I only have to go in 2-3 days a week. So I'm less bothered about a long commute, but I want a backyard and I want a home office, etc. So there's been a huge movement out to the suburbs, particularly outer suburbs, and that's pushed up prices and rents in the outer suburbs and actually relatively pushed them down in the city center. And for firms and businesses, many more employees and customers have moved out. Second effect is this is a different data set for MasterCard. So I've been working with MasterCard. Again, we have zip code level monthly data. Again, incredible data. What you can see is people moving out, this donut effect to the suburbs has pushed up expenditure in the suburbs, pushed down expenditure in city centers. So I was talking to one large sandwich chain, the board of, I won't mention them, but they're a very famous sandwich chain. I'm sure everyone's bought food from them. And they said, business has been reasonably good, but it's been pretty soft in city centers. We've sold less sandwiches, but it's booming in the suburbs because people are working from home and they're going to get a sandwich at lunch and they're just going to the shopping mall rather than, going down the street when they're in the center of town. So on the right is the average for all big US cities. And you can see there's a kind of a permanent reduction in spending. If we look at individual cities, what we see is the drop in the city center has been largest in northern and western cities. So Chicago, New York, San Francisco, Washington, D.C., pretty big drops in the center. People moved out to the suburbs. If you look more at the south and the southeast, Atlanta, Dallas, Miami, Houston, they've actually seen a pretty full rebound of city centers. So there is, this skew of people moving out, particularly in the north, northeast and the west. And then finally, golf. I don't even play golf. So many people, so many execs said, like my golf game's been really disrupted. I can't get around anymore. It's jammed, it's like really busy. So I was like, okay, is this in the data? So with another data set called, from a company called INRIX. So INRIX have fantastic data on GPS. They have about 150 million journeys a day of cars in the US. And so you can tell when people are playing golf because they drive to and stay at a golf course between 2 to 6 hours. That's too long for lunch typically and too short to live there. Everyone drives to, nobody really walks to play golf. Nobody bikes there. So we pretty much measure all golf games in the US quite easily. What you can see is in 2019, people are playing golf on the weekends. It's mostly weekends. There's a bit on Friday. By 2022, it's like flat all week and really high. So all week, when you talk to golf club owners and grounds people, they're like, it's jammed, from morning to evening, it's just full. We not only have the day data, we have the hour data. So if you look at hour of the day, what you can see is pre-pandemic, people were playing golf in the week, but it's mostly before work. There was, sneaky games at 8 or 9, and then you go into work a little bit late. Now it's just all day. And the only reason it's not, it drops a bit in the middle of the afternoon, it's in the south, it's so hot. You can't play. So basically it's maximum capacity. And so I put this up to highlight two things. One is the pandemic has really shifted our work leisure life. So think of golf, but think of going to the gym, going to hair salons, going shopping, going to the dentist, playing pickleball, skiing, whatever activity, leisure activity you think that used to be on the weekends has now been moved throughout the week. And that's skewed demand. Office use is now crushed into the middle of the week, whereas leisure activities has been spread throughout the week. It affects demand. Is also a good reason why you want performance review data. So, coming back to why you should want performance review of your employees, if Mark is managing me, I may well be one of the data points playing golf in the middle of the week. Now, if Mark has performance objectives for me, it's totally fine if I play golf for 3 hours on a Wednesday and then basically work for 3 hours extra in the evening and don't watch TV. It's much more problematic if I just play golf and don't do my job. So there is, a skew in what people are doing. And there's also much more leisure being taken during the day. And in fact, we see in other data, people are working more in the evening. So they're moving around their day. So to end, what about the future? Well, I wrote a piece in The Economist magazine. I'll kind of summarize it now. It basically talks about a Nike swoosh. So work from home is dropping from 2020 to 22. It's been flat this year, probably be flat next year. But from about 25, 26 onwards, work from home levels are like to start rising. Why is that? Well, there's two things. One is just technology is getting better. So as technology improves, think holograms, virtual reality, augmented reality, these headsets, better videos, better laptops, better software. I mean, Zoom is so much better than it was 3 years ago. It makes work from home easier. So over the long run, technology is super important. I'm, one of 4 kids. Both my parents worked. When I was a kid in the 80s, they used to work from home a bit, and it was terrible. It was like carrying pieces of paper home and back. The personal computer came in the 90s, the internet in 2000s, cloud, Zoom, Dropbox, 2010. Technology matters a lot. And in the long run, this is going to get dramatically better. It's going to push up work from home. The other thing is what we call cohort effects. Younger firms, younger CEOs, younger employees, younger managers are more in favor of work from home. And as these firms grow and as these managers get, older and become tomorrow's big CEOs, they're going to take this with them. So to conclude, work from home is here to stay. It's been flat for the last year. This is the new normal. Typically, it's 2 days a week for the average office worker. The key to make this successful is coordinate, so people come in on the same days. They work socially together. They enjoy it. They say, I'm happy I came in. They don't spend all day on Zoom. We need to redesign offices. You need to redesign, performance appraisals. And I continue to put stuff out. So, follow me, connect up on LinkedIn. And we also have a website, wfhresearch.com. And I'll stop now and go to Mark for questions. Thanks.
Well, thank you, Nick. This is a great way to wrap up the summit. We've gotten a lot of questions about work from home and hybrid environments. So this is really interesting research. I don't play golf myself, so I don't feel personally attacked, but that's a really interesting data point. I love what you were saying about how firms care about profitability and not productivity. I think that's a great way to frame this. We've gotten a lot of questions in the chat or in the Q&A box about how hybrid work and the pandemic have changed culture. And specifically, this is a National Safety Council event. How has it changed safety culture, if at all?
That is a great question. So in terms of how it's changed culture, hybrid, if you're in 3 days a week, doesn't look like it's had a huge effect on culture because you tend to get enough connectivity. It gets harder if you're going to less days or fully remote because people aren't connecting up a lot. One of the things I actually worried about, I mean, it'd be good to hear from the audience if they've heard any examples, but early on is this fear about safety, particularly at home. So I remember in Germany, there was a case of somebody that was, I mean, it sounds ridiculous, but was standing on their chair to do a Zoom thing, fell off, broke their leg, sued their employer. The employer said, well, look, we never suggested you stand on your chair to take Zoom, but, they said, well, for whatever reason, actually, that there was a payout. So the one safety angle I've heard is some employers are there worried about employees' home environment. We'll ask them to take a photo, go visit it, maybe pay for equipment. Hybrid, apart from that, is relatively straightforward. Fully remote is definitely much more of an issue. So for fully remote, Stanford University only allows you to be located in the US. It won't let you connect in. People can get around it with a VPN, I guess, but it won't let you connect in if you're overseas. They want to check. So yeah, fully remote is definitely an issue. There's a related issue on that, by the way, on tax. So I don't know how much people are aware of this, but if you have, a material number of employees in any state, you have to file state tax returns and life gets complicated. So often another issue is some employers will say, here's a list of 12 states we're allowing you to work in. And they're typically the big ones like, California, Texas, Pennsylvania, etc. But if you're worried about any state with a crime level or cities, you can also put that down.
Well, and it's a great point too, because as our last panel, Ken Mead was talking about the importance of workplace ventilation, and that kind of got us on the line of thinking about the definition of workplaces really is changing, so that more businesses need to think about some of these safety measures like healthy air at home, ergonomics, those kind of things. So it sounds like this is a topic that a lot of businesses should be thinking proactively about.
Yeah, I'll tell you an amazing study, actually. There's a guy, Robert Metcalf, who's at University of Southern California, who I don't know if it's public, but I'll kind of tell you what I know about it. It's pretty fascinating. So he got, I think it was like a couple of thousand households, and he got PQI measures. I'm not an expert on it, but, the particular measures of what's in the air. And he put them into, I think, 2,000 households, and randomly 1,000 of them, he let them see the readings, and the other 1,000, they just had them there measuring, but they didn't see what's going on. What you saw in the study is as soon as people could see the readings, their pollution at home started to go down a lot. What he said going on is folks are they're sitting at home, they're frying eggs in the kitchen, they're then going to spend the day sat in the kitchen, breathing in this horrible stuff, or they're making toast, or they're smoking. He said it turns out the air quality at home is substantially worse. Like if you're in the office, there's no way someone would be like frying eggs next to you and you sitting and breathing all that. But that's very standard at home or cooking. And people smoking or having wood fires, etc. So I think he's looking to an important thing is I think the air quality is actually typically much better in the office than it is at home. And I don't know whether we're going to see a trend towards more PQI. Living out in California, we have one at home because of I heard someone in the last call just talking about wildfire smokes. That is a real issue actually, and offices probably better on that front than households actually.
Well, it's a really good point, and something we at Health Action Alliance have been really focusing on with our National Commission on Climate and Workforce Health, thinking about climate change, so things like wildfire, smoke, and extreme weather events really impacting how employees are healthy and safe. And so I guess that brings up a question of, have you seen a lot of geographic differences from work from home stats? And are people shifting to areas where there's less extreme weather events or less impacted by climate change? Is this something that's been factored into work from home setup research?
The geographic element, again, there is geographic element certainly across countries. In the US, it tends to be more of a city thing. But cities around the country tend to have more work from home. Very rural areas, perhaps surprisingly, have lower levels just because the types of jobs and people that live there. I think a really important connection to safety, again, is what I'll call events, including climate events. So if you remember, about 2 weeks ago, a huge freeway in LA was taken out by a massive fire. And I think that freeway is out for like 6 months. I mean, I think it's been a permanent issue. Or think of when there was, the big snow dump in Boston, or, sometimes there's, high winds or wildfires. These are times where it's potentially risky and unsafe for employees to be trying to get into work. If you have a hybrid setup and you're, familiar with work from home, you can much more easily tell employees, look, it's unsafe, it's extremely high winds or extremely, icy roads. Please work from home the next 2 days. If you've been doing it on Tuesday and Friday every day, or, Monday, Friday, that's quite straightforward. If you're forcing people in the office 5 days a week, it's then quite hard to scramble into a work from home setup. So this kind of agility, I think, is important in terms of safety, because there's, I would say the typical workplace probably has maybe 1, 2, 3 days a year on average where it's maybe unsafe to commute. Weather's most obvious: heavy rains, high winds, snow. But there are other issues. I mean, the LA thing was, a fire, and so coming back to this has come out to be another big issue, that the agility that regular work from home gives you improves workplace safety.
Well, and I think this is an issue that we're just seeing increasing conversation around climate and workforce health, and I think this is something that won't be dying down anytime soon. But another question from our audience was around suggestions you have for workforce where half can work hybrid and the other half must be on site. How do you balance issues about equity and concern for equally compensating your employees when some of them have to be on site and some don't?
Yeah, that's definitely hard. So a few thoughts here. One is it's particularly tricky mixing it within teams. So one of the hardest things is you got a team of 8 people, they're doing the same task. I would really try hard to avoid mixing with it. It just doesn't seem fair. I mean, it's actually interesting. You notice Zoom made this announcement that if you live within 50 miles, you have to be hybrid. If you're more than 50 miles away, you're fully remote. That is not a long-run sustainable setup, because there are 10 of us in the team. 6 of us live nearby. We're not having to pay to come in 2 days a week. The other 4 are living somewhere cheap and not having to commute. So one thing is try and differentiate it by teams. Secondly, a number of employees, it's now more historic, but in 21, 22, when they were calling people back, were setting up pay differentials. They would say, look, if you are in a team and for some extreme reason you've got to be fully remote, well, you're going to have a 10% pay gap with your colleagues. You can think of the reverse for coming in every day. You may give people, higher raises to compensate for having to come in every day. A third thing I've heard is a number of folks have to come in every day. We'll say, look, we've had some shift alignment. Depends on what your role is. But I was talking to a hospital that said, what we've done is rather than have people come in for 8 hours a day for 5 days a week, we've given them the option to come in for 10 hours a day for 4, or in certain cases for 13 for 3. Now, you'd think everyone may go to the latter ones because you have to commute less. But, they said, well, some people have kids and they're, disruptive and they want to be home for dinner with their children, etc. But that is definitely another degree of flexibility you can put together. So yes, it is an issue. And by the way, on the cross-industry graph, if you look to the bottom, There's things like, food service accommodation. When I've talked to managers in these industries, they say, look, even the IT person or organization is coming in 4 days a week. Why? Because if the frontline staff are in every day and the manager, the junior manager in every day, it's very hard for the IT person to connect in if they're in their pajamas at home. So even people whose roles potentially could be more remote are kind of being brought in more in person and in-person type organizations, so they connect up better and you maintain culture better. And really it is a sense of equity. So these things tend to adjust. You tend to have the fully in-person people, see if you can flex up to give them a day a week off, and the fully remote people have them come in a bit more to try and minimize this gap.
Right. Well, some of the comments in our Q&A got your golf game research was particularly compelling, and somebody noted that while he does not golf, he surfs and snowboards, and he can say there's a similar trend that he's observing. So certainly some more data that you might be interested in looking at down the.
I would say this is great. I honestly think this is a really good thing. Look, for me, I like to, pick my kids up from school or sometimes go run, etc. And I want to do that in the day. And the day in the wintertime is only, during the working day. So I'm better off being able to do that in the day and then working a bit in the evening. The key, so what, is just to have reasonable performance management, because then you can let employees get on with their life. And
And that's a big question that has come up a few times in the Q&A is, effective strategies for managing hybrid remote teams. You mentioned the walking around challenges. We've talked a little bit about this golf research. Do you have specific tips on managing both performance as well as culture and psychological safety that we talked about earlier for remote teams?
Yeah, so in terms of managing performance, I can go back, years ago I worked in McKinsey, and we used to have this grid system. We'd meet up formally every 6 months, but more informally, every kind of 3 months. So I'd have a bunch of objectives, and my manager, she would appraise me against them. My last manager, did this particularly well, would appraise me against them, and I'd sit down on a reasonably regular basis with her and get feedback. So one of the things I think you need for more remote activity is be more explicit. Here are your objectives. Here's milestones. Here's where I'm going to collect data. I'm going to talk to customers, competitors, look at some numbers. It varies critically. Look, if you're, in a sales organization, it's relatively straightforward, maybe, because you look at the numbers. If you're, say, writing briefs for a marketing campaign, it's much harder to evaluate it. But that's the first thing. The second thing is on psychological safety and kind of health. The evidence looks like the most important thing is letting people choose. So what I mean is, what was very damaging was early in the pandemic and everyone was forced to work from home. If you look in the data, we see 30% of people want to be fully remote, 50% want to be hybrid, and 20% want to be fully in person. So hybrid kind of in the middle, and it's not too far off what everyone wants. When in April 2020, everyone was locked down in large parts of the US, you're getting people that find that really depressing, really isolating. That was certainly very damaging. So one thing is, if you have a large team of which there's a big spread of preferences, hybrid in some sense is a safe middle. In the longer run, what should happen is, if someone's desperate to go in person every day, they should probably move roles within the company or move jobs to do that. If they're desperate to be fully remote, it may make sense that people move jobs. And that's partly why we saw the Great Resignation. So a lot of people churning to try and fit. So it may, you may find some extreme cases it's hard to fit in their current role or organization. You may just want to encourage them to move. If they're deeply unhappy, it's not really sustainable. The intermediate is hybrid. That's kind of in the middle. It's like vanilla ice cream. Most people, that's not their favorite flavor, but no one minds too much.
Yeah, what was it? Avocado ice cream, or I forget what the ice cream that you saw the other day was.
It's like I live in California, so you can imagine, how many different flavors of ice cream there are in a supermarket here.
We have a lot of safety professionals here. Are there any other considerations safety-wise that we should be thinking about from work from home? We talked about ergonomics, ventilation, psychological safety, cybersecurity, I would imagine, is one. Are there others that safety professionals on this call should be thinking about?
So just kind of ticking off a list. Cybersecurity turned out to be a huge fear earlier in the pandemic, and the industry has done very well because we haven't seen a surge of hacking. So I was very worried about it, didn't come to pass. Home safety we talked about earlier, but if you're worried about employees, maybe get them to take a photo, check the equipment. You could do one visit every 3 years. That's kind of some way to do it, to check on how things are going. Two other angles I should mention air quality. The other is commuting. So reducing commuting is good for reducing pollution. It's also good for safety. mortality rates and long commutes are quite high. I mean, I can't remember the numbers. 50,000 Americans die a year in driving. Some share of that's for sure going to be people commuting. So almost certainly it's safer to have employees, work from home a couple of days a week. They're probably less tired. They get 2 mornings a week. They get to sleep in a bit more. So this is definitely a bit, I'm not particularly, fully remote has its ups and downsides, but certainly for managers and professionals, letting them work from home 2 days a week seems to be an easy sell. We see there's no reduction in productivity on the research data. Employees are a lot happier, and it's also likely to boost safety, be environmentally very beneficial. There's actually a paper in the Proceedings of the National Academy of Sciences pointing out that work from home reduces climate gas emissions because of this. There's so much less commuting. It dominates all the other effects.
Well, that's a fantastic additional benefit. So as a final question, this is the time of year we kind of look ahead to the future. So what trends do you see in the evolution of hybrid remote work in the coming year or years? Do you think that we'll stop calling it work from home and just start calling it work pretty soon?
Well, it's a great part. A friend of mine said, "Oh, I'm working from work today." And I was like, that's great. You never would have called it work from work. I think the safest bet is this swoosh. So we are now in the flat period. Nothing that exciting is going to happen this year, next year, maybe even the year after. We are now steady state. So it's very safe to predict what we are now 1 or 2 years. 5 and definitely 10 years out, work from home levels are going to be a bunch higher. Better technology, cohort effect. So if you're senior in an organization thinking of longer run strategy, that is very much worth bearing in mind. Thinking of long-term leases on real estate, that affects that kind of thing.
This was a fantastic conversation. And thank you, Nick, for the insights on remote work. This is great research that you've been doing for a number of years, and certainly the pandemic exacerbated some of these trends, but really appreciate you sharing these insights with our audience today.
Mark, thanks very much. I'm very happy to share the slides, and folks are willing to send them onwards. So I'm an academic. There's no intellectual property, so feel free to circulate them and send them on as well.
Well, thank you. That's worth repeating. A lot of people asked the question. We will be sharing the recording and the slides with everyone who registered for this event next week. So for those of you who are online here and want to share these great insights with your colleagues, please do, because I think there's chock full of really great insights. So thank you again for sharing.
Thanks.
Thank you. Well, that concludes our virtual event. Big thanks to everyone who spoke and shared their work. Anyone who works in the safety field knows these topics discussed today are some of the most pressing in the current times, and they're at the forefront of the modern safety movement. As Lorraine mentioned at the beginning, everything we discussed today is about impacting real people and saving real lives. And we really appreciate all those who took the time to attend today's event. As I just mentioned, today's recording and slides will be sent out to everybody who registered, so you can come back and reference any of these points in this research. You can also refer to the SAFER website for a recording in a few days as well. In the meantime, if you could take a few minutes to provide us feedback regarding today's event by scanning the QR code that you'll see on your screen, we would greatly appreciate it. And if you have any additional questions, please feel free to email safer@nsc.org. We hope you enjoyed today's event and have a rest of your day and week. Cheers.